Hello, 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 everyone out there in YouTube land. This is Dr. Garrett Smith, also known as the nutrition detective around these here YouTube parts. And we are here with another Love Your Liver live stream. And today, so we're still in Idaho, so we don't have the upload speed to put video on. It just doesn't work. So that's why we're still on this. This is the last broadcast for a while from northern Idaho. So we'll be back to our normal studio and our normal video and all that stuff, so you guys can see my pretty face. And today we are going to go over semaglutide and tirzepatide and liraglutide and all of these what are called GLP-1 receptor agonists, which means they stimulate the GLP-1 receptor in the same way that, bile does. We're going to go over that, and we're going to go over how they are going to end in disaster. It is showing right now. Yeah, the links, Joe just put up the links, so that there's a Google Doc. If you want to click on the reference links, or if you want to go look at them, they'll all be in that document. I do my best to go through them in that same order. Sometimes I get a little off because I'm live, and live stuff is that way. Anyway, all those references are there. You can look into them. You can do more research on it. This is what we're here doing. We are trying to protect people from themselves, and particularly from the pharma cartel. So first, let's get into what it is. Let me share my screen. So we have quite a few links to go over today. I will do my best to not make it too long. Here, let me just get into there. And then let me go here. And we'll share that one. Okay. Let me see. Joe, we got it up now. There we are. Okay. Thank you, Joe. So first, I just want to let you guys know where this is derived from. If you remember, if you remember my the snake venom show, like a lot of blood pressure drugs are pharma tweaked derivatives of pit viper venom compounds, and these semaglutide, these glutides, these GLP-1s are distinctly, they were developed from compounds found in the venom of Gila monsters, which is funny because that's from my, Gila monsters are in Tucson. We had one in my yard one day, and they're just these fat little lizards. So they developed it. This Novo Nordisk developed it, I believe, from Gila monster venom. So here's the quote: "A systemic investigation of the composition and activity of venom from the Gila monster, Heloderma suspectum." Oh my goodness. Don't they always just tell us that they're doing things that are suspicious? They always tell us what we're doing. So Heloderma suspectum led to the isolation of a 39 amino acid peptide designated exendin 4, showing 53% structural homology with GLP-1, with the human GLP-1, I believe they're saying. Okay, so we have GLP-1 in us, and the exendin is 53% structural similarity to us. Exendin 4 mimicked, mimic never reproduces the original GLP-1 through stimulating the GLP-1 receptor. Okay. So what we're talking about here is compounds derived from Gila monster venom. And you would assume that if the Gila monster wants to make it and put it into its venom, in some way it's going to be bad for the person who gets bit. Does that not make sense? Why would a Gila monster make things and put it into its venom if it wasn't going to be bad? Nature doesn't want to waste energy. It's not making things that are good for you to put into venom. This should be simple to think about, okay? Now, let me run through. This is semaglutide. Let me make this a little bigger. Oh, wait, sorry. Let me share this tab instead. I got to switch tabs. There we go. Let's see how big we can get this without it being too big. Okay, there we go. I think that's about it. So these are the basics on semaglutide. Now I want to run through this because we got a lot to run through, but I thought I'd give you the basics here. Semaglutide, a glucagon-like peptide 1 receptor agonist. So this means agonist means it stimulates. It stimulates this receptor. It is not glucagon, it's glucagon-like. Now the other thing I want to caution you guys about is everybody's into the word peptides right now in the alternative health world. Just because it's a peptide is just a string of amino acids, a protein-ish, if you will. It doesn't mean it's okay, and it doesn't mean it's good for you. Everybody's got this thing in their mind that like, ooh, peptides, like let's use them. There is very little research long-term on these. And I'm going to tell you about peptides where they say that they just do these things for you. One thing you want to think about is there is no such thing as a free lunch. The toll will always be paid. Nothing good in life comes for free. So I am super suspicious of these peptides. Like if they're making good things happen in your body, where is the cost coming from? There has to be a cost somewhere. You don't just get to inject things into yourself and just be better. This doesn't exist. There's some price to be paid. We don't know what that price is. So just beware and be aware of anything called a peptide where people are automatically thinking it's good. So it's approved by the FDA, who loves us so much, as 3 separate brand name medications: Ozempic, Wegovy, and Rybelsus. So let me go over just real quick. Ozempic is semaglutide injectable, mainly for diabetics. Wegovy is the same thing, semaglutide injectable, but this is more oriented towards weight loss. And Rybelsus is oral semaglutide. So they put it into a pill. The pill is going to be a disaster, as you can see, because they add things to the pill to make it cause leaky gut. It's going to scare the crap out of you, the stuff that they put in it, when you understand what it's doing. We'll compare it to retinoic acid. That'll be fun. So let's go down here. Let's find, well, let me just click on these. This will be easier. So off-label uses. So remember, the FDA allows doctors, which is this is not a terrible thing, but doctors can use medications on what's called off-label use, which means they're approved for one use or several uses, and then doctors, if they feel like it's useful for something else, they can prescribe it off-label, which means it's not the intended use of it, but doctors have this freedom to do it. The FDA has approved using semaglutide for weight loss, marketed under the brand name Wegovy. The recommended standard maintenance dosage for weight management is 2.4 milligrams, administered through weekly, so once a week, subcutaneous, under the skin, self-injections. With growing interest in semaglutide for weight control, healthcare professionals are responding to demand by occasionally prescribing alternative brands of semaglutide, such as Ozempic and Rybelsus, for off-label use, using a drug approved by the FDA for a different purpose. Differences in insurance coverage between Wegovy versus Ozempic and Rybelsus may also fuel this off-label use. So they're just trying to, use your health insurance to pay for your weight loss drug, is what they're doing. I mean, it's sort of a nice thing that they're doing. Excuse me, I drank my water wrong. Sort of a nice thing they're doing, I guess, for their patients, so they can use their health insurance to pay for this thing that's slowly killing them. Actually, one guy, Tuluminati, on I think it's Tuluminati 888, is that right? Anyway, as he was saying, one of the reasons that semaglutide and these other things cause weight loss is because they are slowly killing you from the inside out. And as you'll see, this may be quite true. And everybody's like, people are talking about, oh, the average weight of the US went down in the last couple of years, and this is all due to semaglutide. Well, wasting away is not necessarily a positive thing. And we'll get into that too. Semaglutide operates as a GLP-1 receptor agonist, sharing a remarkable 94% structural homology with human GLP. So that's even closer to what we do, but it's not the same thing. The mechanisms through which semaglutide delivers its benefits in lowering blood glucose levels and promoting weight loss involve the activation of GLP-1 receptors, primarily located in the gastrointestinal tract, pancreas, and brain. Let's go over this. It slows gastric emptying. So that means food does not move out of your stomach as fast. you're going to see how much it slows it down as we go. It's scary. Like, why are people feeling full? Is it because it magically stimulates their brain? No, it's because the food that they ate a day or two ago is still in their stomach. And you're going to see this in the research. The food is just rotting in the stomach. Semaglutide is also considered a long-acting GLP-1 receptor agonist alongside extended-release exenatide and doluglutide. The extended half-life of semaglutide may be attributed to two structural modifications. One modification promotes albumin binding, leading to prolonged renal clearance. So it's slowing the detox in your kidneys. Whereas the other one shields it from metabolic degradation. This could be called detox by the dipeptidyl peptidase 4 enzyme, DPP4 enzyme, okay? So it's slowing kidney detox, and it's slowing the other detox of it. That's what it does. Pay attention here. Both oral and subcutaneous semaglutide have an elimination half-life of approximately 1 week, remaining in circulation for about 5 weeks after the last dose. Let me tell you about somebody I knew who took semaglutide for a week. This person was vomiting 7 times a day for weeks after she stopped. Why would she have been vomiting for weeks? Did you look at the half-life and how long it remains in circulation? You go and mess around with semaglutide and it causes you problems, you're in for a week or weeks of problems because it's still in your system. That half-life should be scary for people. But that's why they give the injection once a week, right? You only clear half of it in a week. There it is. Adverse drug reactions. Everybody on the internet is saying semaglutide is safe, and now tirzepatide is safer. And let me see. Tirzepatide is safer, and they keep coming out with safer and safer ones. Well, that would be the pharma cartel's research telling you that. Are you going to believe that? Do you believe them? They've never lied to us, have they? Okay, so hypoglycemia, low blood sugar. Gastrointestinal side effects like my friend had. The adverse effects most frequently reported and most associated with discontinuation of semaglutide. So the things that make people quit include nausea, vomiting, abdominal pain, constipation, and diarrhea. Those of you who understand toxic bile theory, and if you don't understand toxic bile theory yet, you're going to want to do some research on this because we're going to show how messing with bile is how this stuff works. Okay? You're going to want to watch episodes 53 or 71 on this channel. Now, Nathan, one of my practitioners, Nathan Wiens, PA, and I are going to be working on a short book, hopefully to be available on Amazon, like short book about toxic bile theory, specifically the basics of it. And so hopefully those of you who want to help your friends or family members or have something in written form about this, we just met this weekend up in Spokane and we talked about it, and we're going to get that out as soon as we can. And hopefully that's going to lead to bigger books to get to the more general populace, this critical information. Okay. But if those of you who understand toxic bile theory, nausea, bile in the stomach, vomiting, you're vomiting that bile in the stomach, abdominal pain. Well, this toxic bile is damaging everything it touches, so it hurts. Constipation. We're going to go over this. Constipation can commonly be from the bile that you're making not going into your intestines and going into your bloodstream. So it's going into your bloodstream instead and not triggering your bowel movements. So think of it this way. So this is going to show you semaglutide and these other medications are messing with your bile in all sorts of ways. It could make your bile go back into your blood, and that would result in constipation. It could make an excess amount of bile go into your intestines, which then results in diarrhea. For those of you out there who want a medication to have like one type of side effect, it doesn't work that way. Some people go one way and some people go another way. Until you understand that, you don't get to figure out health. If you want all the research to say, well, this does this all the time, you're missing the way that these things actually work in the human body. It doesn't matter how we want it to work. It only matters how it actually works. Okay. Nearly 1/5, 20% of all patients in clinical trials with Ozempic and Rybelsus experience nausea, which is the most prevalent adverse effect, whereas 44% of patients treated with Wegovy reported the same adverse effects. So you might as well say, so remember, pharma loves to make up things and downplay the problem. So I would say it's at least 44%. It's not just 20%. It's more like 44% or more, because they will not tell us the truth. They are padding their tests. They are scoring their own tests. In addition, decreased appetite, dysgeusia, I think that's how you say it, and dyspepsia have been documented. Okay. Decreased appetite, that's what they want, right? That's the goal. Well, let me tell you a theory of mine about intoxic bile theory is, so you know how they said constipation, and I said this is bile going back into the blood? When people are this is the theory of mine, when people are dumping bile right back into their bloodstream, intrahepatic cholestasis, that is when it really decreases your appetite. So is it that the food is sitting in your stomach? Is it that these drugs are causing bile to go back into your blood? And when we see this, decreased appetite is an under type thing, an underweight thing. I believe that this medication is basically turning people into undertypes by damaging their liver. And those of you who understand toxic bile theory and you're in the Love Your Liver program and you understand these concepts, you're going to see the patterns that I do, hopefully. So dysgeusia, geusia, let me go to that one. Let's share this one. Dysgeusia, there it is a condition in which a foul, salty, rancid, or metallic taste sensation persists in the mouth. Dysgeusia is sometimes accompanied by burning mouth syndrome. So now, you know how I just told you nausea and vomiting, bile in the stomach, bile coming up? Do you think that if the bile was, maybe you weren't vomiting, but the bile was coming back up into your throat? If you haven't seen my GERD episode, you should see that one, connecting that to bile reflux. But do you think if you had nasty toxic bile kind of burping up into your throat, but it wasn't enough to trigger vomiting, that you might have a nasty taste in your mouth? Do you know what's in bile? Toxic bile? All of your toxicities. Gosh, why would it taste rancid? Oh, you got food rotting in your stomach. Oh, salty. Well, what's your stomach acid? Hydrochloric acid. Do you think that might kind of taste sort of like salt at times? Foul is just rotten food. Metallic taste would be like toxic metals in your bile burping up into your stomach. Oh, a burning mouth sensation. Does bile burn? Those of you who have vomited up bile, yellow bile particularly, you know that burns and it tastes awful. They're telling us that this is bile coming back up into your stomach. Okay, what was the next one that I had? There we go. Okay, dyspepsia is heartburn. So they're saying it's heartburn. They're saying this taste is here, decreased appetite. You got food just rotting in your stomach. They've been documented. Okay, so although the precise mechanism behind these effects is not entirely elucidated, it may stem from delayed gastric emptying, the food rotting in your stomach, sitting there too long, or the activation of brain centers implicated in appetite regulation, satiety, and nausea. Oh, sorry, I got to switch tabs. There we go. Yeah, got it. Okay. Higher doses and dose escalations are associated with the risk of these adverse effects. Well, we don't dose dependent means the more of the poison you take, the more of the poison effects you get. It's not the dose makes the poison. It's that the more poison you take, the more poison effects you get. It's pretty simple. So renal, kidneys, semaglutide can result in acute kidney injury. Gallbladder disorder. Semaglutide has been associated with gallbladder and biliary tract issues. Gosh, toxic bile? No way. Causing bile problems, including cholelithiasis, kidney, this is gallstones, and cholecystitis. This is inflammation of the gallbladder. But then you'll see in this research, they'll try to say that, oh, semaglutide and these other GLP-1 RAs don't affect the liver. Yeah, okay. Anaphylaxis and angioedema. GLP-1 receptor agonists, as in semaglutide and the others, can induce severe type 1 hypersensitive reactions, an anaphylactic reaction. You guys may want to go watch my anaphylaxis episode and see how all of this is connected to toxic bile. Anaphylaxis is a massive dump of toxic bile into the system, causing a massive reaction by your body, threatening your life. For those of you who didn't watch the anaphylaxis episode, they did a study on dogs who had anaphylaxis and dogs who just had allergic reactions. They did ultrasounds on the dogs' gallbladders. The dogs who had anaphylaxis, they could actually visualize, they could see a hole in their gallbladder, an actual hole. So their bile ate a hole in their gallbladder. And then when whatever triggered the anaphylaxis for the dog, the specific allergic trigger, however that happened, they dumped all that bile, it leaked through the hole into their blood and caused these dogs to have a life-threatening reaction. So anaphylaxis and sepsis, which is one of the side effects of these drugs, we're going to go over that in a paper. Anaphylaxis and septic shock, sepsis, are bile leaking into your blood. So the other ones, they could have anaphylaxis and angioedema. Let me go show you what angioedema is, just in case you didn't know. Angioedema is swelling that is similar to hives, but the swelling is under the skin instead of on the surface. Hives are often called welts. There is a surface swelling on hives. It is possible to have angioedema without hives, and many times angioedema can come with hives. So it's a nasty reaction happening in your skin. So let's keep going on this. Pancreatitis. Let me show you, again, to connect bile to this. Well, let me show you a picture in a second. GLP-1 receptor agonists directly stimulate GLP-1 receptors in pancreatic islet beta cells and exocrine duct cells. Exocrine means they are pushing out hormones. They're pushing out things. Researchers suggest that this stimulation may lead to the overgrowth of cells. I want you to pay attention here. Those of you who understand toxic bile theory, this will make sense. It will lead to the overgrowth of cells covering smaller ducts, causing hyperplasia, increased pancreatic weight, duct occlusion. This is the blocking of ducts. Ducts are tubes. Back pressure, and subsequent acute or chronic inflammation. So let me, Joe, I'm going to do a new, let's go pancreatic duct. I'm going to find a picture of this. Find a good image. World Pink. Why is this not opening the image? Come on. Wait, we're going to get it. Well, we're just going to look here. This is close enough. So over here, look at this picture. Let me make it a little bigger. There we go. So they don't really have the liver in this picture, but the liver connects to the common hepatic duct that a lot of times they call it just the common bile duct. Yeah, there it is, common bile duct. Pancreatic duct connects to the common bile duct. So we are seeing bile going back up into the stomach. Well, the bile can also go back up into the pancreas. What could this, oh, geez, sorry, I accidentally clicked on it. So then this bile goes back up into the pancreas. It irritates the pancreas and causes acute pancreatitis and pancreas inflammation and can worsen eventually diabetes. If you haven't seen my diabetes live stream, you might want to go watch that one. Diabetics had twice as much bile in their blood leaking as non-diabetics. So bile duct occlusion or pancreatic duct occlusion causes, so do you think that bile could get back up here and cause these problems? Yes. And then you get pancreatic inflammation, pancreatitis. Okay. So let's get back to this. So just remember, anytime you block a duct, a tube, it's going to create back pressure, as they're saying here, and then it blows out the tubes. And then people start leaking toxic bile from the bile ducts into the system. Diabetic retinopathy. Semaglutide use may potentially elevate the risk of diabetic retinopathy. Wait, so they're taking a drug to help their diabetes, but it can cause a classic diabetes symptom, which we associate with excessive vitamin A in the eye. Weird. Weird that this would slow down detox and then cause toxicity problems. Risk of thyroid C-cell tumors. Oh, I got to share the right tab. There we go. Risk of thyroid C-cell tumors. During the initial phases of drug development, animal studies involving semaglutide revealed the development of thyroid C-cell tumors. What causes cancer and tumors? Toxicity. However, the potential association between semaglutide and thyroid cancers in humans remains unclear. We would never want to accuse a pharmaceutical of causing cancer, right? Individuals with a personal or family history of medullary thyroid carcinoma or those diagnosed with multiple endocrine neoplasia, this new growths, that's what that means. Type 2 syndrome may face an elevated risk. Genetics loads the gun. Environment pulls the trigger. You take the wrong toxic medication or Gila monster venom poison, and it accumulates and causes the body to grow new toxin storage sites we call tumors or cancer. The manufacturer acknowledges reported cases of medullary thyroid carcinoma associated with liraglutide, which is another GLP-1 receptor agonist. So, thyroid cancer. That sounds like fun. All to lose some weight, which is going to come back. Is one of the things folks who are maybe doing these, generally, you're signing up for a lifetime of this drug. Because what is this drug fixing permanently that when you take it away, that problem is going to be gone? Do you understand that the problem is never going to be gone because this drug does not fix the cause? So Big Pharma is basically getting you hooked on a lifetime drug to help you with weight loss. And I'm going to show you the long-term stuff on it. It's going to be very bad for your liver and everything else. Additional adverse reactions. Other reported adverse reactions associated with semaglutide include fatigue, headache, vitamin A toxicity, like retinopathy, rash, alopecia, hair loss. That would be great. You can be thin and lose your hair. Vitreous hemorrhage in patients with diabetic retinopathy. This is a bleeding in your eye. Anxiety, dizziness, discomfort at the injection site, and erythema at the injection site. Well, those are normal things when you inject a poison. You'd have redness at the injection site of a Gila monster biting you and discomfort. So, healthcare providers should assess the risk of gallbladder or ductal disease, as in bile duct disease, and pancreatitis in patients using semaglutide who exhibit characteristic signs or symptoms. Do you think any of these practitioners who are out here prescribing this are asking people about this? Do you know how easy it is to get a prescription of this on the internet? You send them your height, your weight, a picture of yourself, and the payment. And they are putting you on this. We're going to get to this at the very end. Oral semaglutide is often co-administered with SNAC, SNAC, to increase gastric absorbability. Animal studies have indicated that higher SNAC exposure can result in lethargy, fatigue, right, being not wanting to move around, abnormal respiration, so atypical breathing, bad breathing, ataxia, and reduced activity. Well, that'd be great if you take a diet drug and it makes you move less. Brilliant. Okay, if you guys don't know, if you didn't see my weight loss and toxicity live stream a couple ones ago, you should watch that one, because that would be weird if it slowed your detox and then you can't get rid of toxins and your body tries to make fat to hold fat-soluble toxins. So then you're stuck on this drug forever, because as soon as you come off of it, you start detoxing, but then your body puts it back into the fat because it will kill you if it comes out too fast. This is how people who do tons of weight loss drugs over time, they eventually just start getting fat again, because their body would rather put on the fat and store the toxins in a diluted manner than lose the fat and unleash this torrent of toxicity into your bloodstream. Your body is protecting you from dying by making body fat. It's not a good thing. It's a desperation move. But yeah, if you haven't seen the toxicity and weight loss one, you should go see it. Okay, so let's just go over this real quick. Those of you who want to research this, remember all the people on Twitter and everywhere telling you that this is safe. Are there class action lawsuits already over these drugs? Yes. Semaglutide, marketed as Ozempic, is a medication used to treat type 2 diabetes and obesity. However, numerous individuals have filed lawsuits against Novo Nordisk, the manufacturer, alleging serious side effects, including gastroparesis, a condition characterized by delayed stomach emptying, leading to symptoms like nausea, vomiting, and abdominal pain. I'll come back to that one. Vision loss. Reports of NAION, non-arteritic anterior ischemic optic neuropathy, a condition causing permanent vision loss or blindness. Intestinal blockage, allegations of intestinal blockage or ileus, which can lead to severe abdominal pain, nausea, and vomiting. Current status as of November 2024, there are multiple multi-district litigations, MDLs, and class action lawsuits filed against Novo Nordisk. This is the early stuff, folks. In 2019, in some of the papers, they were saying there's no problems with semaglutide. It's totally safe. Now we're 5 years later and there's multiple lawsuits. Never trust the pharma cartel, ever. Do not trust them about certain pesticides like ivermectin. Do not trust them about these new weight loss drugs. Do not trust them about anything. So gastroparesis, we have talked about this here on the live stream, because what is one of the things that bile going into your stomach will cause? Bile can cause paralysis of muscles. What is gastroparesis? It's paralysis of your stomach. Wow, nausea, vomiting, gastroparesis. We have helped people fix gastroparesis by helping them get the bile to go where it's supposed to go, which is not backwards up into your stomach, causing nausea and reflux and vomiting and gastroparesis. Gosh, do you think these people with the gastroparesis have been doing this drug for a while longer than others? Maybe. Vision loss. Well, this is just telling you that it's toxicity. There's toxicity backing up into your system, and it's accumulating in your eye. Headaches and eye problems would tend to go along with potentially vitamin A toxicity, and then intestinal blockage. Okay. Well, if I tell you that toxic bile can paralyze things, there's that. There's also, let's say, if bile is proper amounts of bile in your intestines is necessary for you to poop properly. It is bile that triggers your pooping. The right amount of bile. Too much bile is diarrhea. Not enough bile in your intestines is constipation. So could you get potentially an intestinal non-functioning problem from, let's say, too much toxic bile in there, causing paralysis? That's what it does in the stomach. Why couldn't it happen in other places? Or not enough bile going into your intestines and then causing a lack of pooping completely, and then you don't poop and you get an intestinal blockage. Wow. Okay. So Baptized in Fire said semaglutide is so bad, a local pharmacy put up a billboard warning people against it. A pharmacy did that. LOL. My buddy in Tucson who owns a gym told me that he was in a networking group, like a business networking group, and it was very heavily populated, or all populated, by men. And he said so many of the men in there were just doing semaglutide and testosterone replacement. He's like, none of them are willing to exercise. These generally wealthier guys, upper class guys, they refuse to exercise. And so they just get on semaglutide so they can be leaner, and then they get on testosterone so they can be bigger. Their liver, they're going to pass early. I could pretty much guarantee it. It's not going to end well. So if you think that everybody's telling you that it's safe, the class action lawsuits have started. Okay. Wait, there's nothing on that one. Okay, let's go to the next one. Okay, so now we're going to go into how the connections between bile and semaglutide and these other GLP-1 receptor agonists. So I want you to remember one thing first of all, is that the pharma cartel science and conventional medicine science, they often get things wrong, and they'll say that this causes this, when in actuality it's backwards. They just see that they're connected. They don't get the order right. It'd be like when they say, oh, this disease causes this disease. No, the disease process caused both of them. It's likely the same disease process. It's just a progression through of it. It's not one causing another. It's that different links in the chain break down at different times. Okay, so what I'm going over here is I'm connecting these drugs to bile and the liver. And then you're going to see, because if anything connects to bile, it's connecting to the liver. Bile acids trigger GLP-1 release, predominantly by accessing basolaterally located G protein-coupled bile acid receptors. Bile acids are well-recognized stimuli of glucagon-like peptide 1 secretion. So this is normally what happens in the body. You think they're connected at all? Yeah, they're connected. Let's keep going. So I'm just showing the connection here. You're not going to, the pharma cartel is not going to tell you how these mess you up. I have to do it indirectly through the research. Role of bile acids and GLP-1 in mediating or causing the metabolic improvements of bariatric surgery. So this is like stomach stapling. So this is GBIL. Sorry, GBIL, bile diversion to the ileum. They're diverting the normal bile flow. Okay. Bile diversion induced weight loss and improved oral glucose tolerance in high-fat diet-fed TGR mice, but not FXR. This is actually, FXR is one of the bile receptors, one of the bile acid receptors in your body to tell your body to make more bile or less bile, depending upon where it is, suggesting a role for intestinal FXR, that receptor. Bile acid diversion in wild-type chow-fed mice prompted weight-independent improvements in blood sugar and glucose tolerance secondary to augmented insulin responsiveness. Isn't that what they say that these drugs do? So they're saying moving around the bile, diverting it to a different part of the intestines, changed these things. Improvements were concomitant with increased levels of lymphatic GLP-1, your sewage system. So there's more GLP-1 in the sewer system in the fasted state, and increased levels of intestinal Akkermansia mucinophilia. That's a probiotic. Improvements in fasting glycemia after bile acid diversion were mitigated with X9, a GLP-1 receptor agonist. I think this is exenatide or whatever, the one we went over first. Or cholestyramine, a bile acid sequestrant, a bile binder. The glucoregulatory effects of bile acid diversion were lost in whole body GLP-1 receptor. The minus means they didn't have the GLP-1 receptor. The blood sugar regulation effects of diverting the bile to a different part of the intestines were lost when they didn't have the GLP-1 receptor. Bile, GLP-1 receptor. Soaking up bile made the GLP-1 antagonist not work. Diverting bile changed the fasting blood sugar to better. Do we understand that GLP-1 receptor agonists are going to mess with your bile process? Conclusions: bile diversion to the ileum improves glucose homeostasis via an intestinal FXR GLP-1 axis. Altered intestinal bile acid availability independent of weight loss and intestinal acromansia, appear to mediate or regulate the metabolic changes observed after bariatric surgery and might be manipulated for treatment of obesity and diabetes. So they're going to manipulate your bile. That's what it's doing. Okay, so let's just go over a little bit more about GLP-1 and bile. Postprandial, this means after you eat. Dyslipidemia, that's messed up blood fats like cholesterol and triglycerides. Hyperinsulinemia, high insulin, and impaired gut peptides / bile acids in adolescents with obesity. So younger people with obesity. Adolescents with obesity exhibited fasting, so they're not eating, and postprandial dyslipidemia, particularly augmented as this is an increased postprandial after they eat excursion, that's how much they go off normal, of large triglyceride-rich lipoproteins. Postprandial glucagon-like peptides were reduced and inversely correlated with postprandial dyslipidemia and insulin resistance. Postprandial bile acids were also diminished, particularly lithocholic acid, a potent stimulator of GLP-1 secretion. Lithocholic acid, LCA, this is like one of the worst secondary bile acids. This is one of the most damaging. This means stone-forming secondary bile acids. Secondary bile acids are made by your gut bacteria. Lithocholic acid is a potent stimulator of GLP-1 secretion. Are you seeing the bile connection here? It could be that if bile acids in the gut, I don't know if they mean these are serum or it doesn't really matter. I could look it up, but I don't know if these are serum or in the poop or in the blood. I mean, the blood would be serum. I didn't look at this, but I'm just connecting the bile here. Okay, they're not going to tell us what this does long term. Oh, wait, different effects of once weekly and once daily administered GLP-1 receptor agonist, semaglutide and liraglutide on bile acid diarrhea. Okay, bile acid diarrhea. Put simply, you have too much bile in your poop. It is irritating your intestines. It is triggering you to poop before you can absorb enough from the food, so you're just pooping out watery diarrhea. So they just said, watch what it does. So I'm telling you that these drugs affect bile. Bile acid diarrhea is a socially debilitating disease. Typical symptoms include loose stools, urgency, and high stool frequency. Recently, we reported the superior efficacy of the glucagon-like peptide 1 receptor agonist, GLP-1RA, liraglutide, administered subcutaneously once daily, so that's an injection every day, in reducing daily bowel movements compared with the traditionally used bile acid sequestrant colesevelam, considered the standard of care. I've never even heard of this. This has generated proposals of testing longer-acting and more potent GLP-1RAs for treating bile acid diarrhea. Here we present a patient with severe bile acid diarrhea who experienced minimal effect of the once-weekly administered GLP-1RA semaglutide, but total remission of bile acid diarrhea symptoms during treatment with liraglutide. It shut down all the bile going into the excessive amount of bile going into his guts. Are you seeing that it affects bile? Do I need to make this any clearer? That is what mediated the weight loss in the bile acid diversion surgery. There's differences in the bile between adolescents with obesity and normal. It's a bile affecting drug, which is going to explain the disasters that it causes. Let's go here. Okay, so here's what I want to show you. We're going to go into the duration paradox here. What is the duration paradox in terms of what we're talking about with semaglutide and these other GLP-1 receptor agonists? Well, they're going to say that it looks good, that it's doing good things for your liver, and it's helping you to be healthier. These are short-term studies. Remember how I said 5 years ago they weren't finding anything bad with it? And now there's class action lawsuits, and you're going to see lots of other case studies of really bad stuff going on. Duration paradox says that the very drug that can look amazing short term will cause the very problems that it seems to be helping long term. So if these drugs help with whatever it is that is related to bile in terms of obesity, over time they will cause they will cause the problem that they supposedly fixed. Just like caffeine, when you first take it, seems to boost your energy only. And as you drink it every day and you drink enough of it and you drink it long enough, it makes you more tired overall than you ever were before. And you have to take the drug to be normal, to just be normal. So let's look at the bonuses from what do these drugs help with? Effective semaglutide on liver enzymes and markers of inflammation in subjects with type 2 diabetes and or obesity. Well, remember I told you that diabetics had twice as much bile in their blood. Well, if these are affecting the bile, then it might look like it helps in the beginning. Semaglutide significantly reduced ALT, a liver enzyme, and high sensitivity C-reactive protein, which is a marker of inflammation, in clinical trials with subjects with obesity or type 2 diabetes. So they're going to try to say it's good for your liver. It reduced this liver enzyme short term, and it reduced this marker of inflammation. Let's see, how long was it? 104 week, 52 week. Well, again, they used to say that there were no problems with this. They used to. 2019. Effect of semaglutide on fatty liver disease biomarkers in patients with diabetes and obesity. These results show that weekly subcutaneous semaglutide has a beneficial effect on liver steatosis, that's fatty liver, that went beyond glucose control. Its effects were mainly related to weight loss, a decline in biomarkers, so just blood tests, and improvements in insulin sensitivity, which is probably the HOMA-IR. Is that what they did? Doesn't really matter. So I'm showing you when people are like, oh no, it's got so many benefits. Yeah, when was this? 2023. This is in the research. They're going to try to show you that it's good for you. Isn't that what the pharma cartel wants to do? They want to sell you their products. Things are going to get pretty ugly here. Okay, so now we're going to go into some of the problems that it causes. So what I'm telling you is when you mess with bile and the liver for short-term benefits, it's going to end badly long-term. Let's start heading into that. Drug-induced autoimmune-like hepatitis, so liver inflammation like autoimmune, which is toxicity, and cholelithiasis, this is gallstones, associated with dulaglutide and semaglutide use in a young adult, a case report and review of the literature. A young adult. So you don't even got to be old to get these problems. Let me make this bigger. Only a few cases of liver injury. Remember, modern medicine is terrible at finding liver problems. They're absolutely terrible. So if they say there's only a few cases, that means there's a lot. Of liver injury induced by liraglutide, glucagon-like peptide 1 receptor agonist, with complete recovery after drug discontinuation and administration of corticosteroid have been reported. So they mean it's the drug causing the problem. This report presents the case of a 29-year-old Saudi female patient who presented to the emergency department complaining of acute right upper quadrant abdominal pain for 3 days. They're saying it's the liver. That's what's hurting, liver or gallbladder. She was an occasional smoker for the past 10 years with no relevant medical or surgical history. The young female developed autoimmune-like hepatitis due to the intake of dulaglutide and semaglutide, which are medications used for type 2 diabetes. Studies regarding the effects and association of dulaglutide and semaglutide to cholelithiasis, gallstones, and autoimmune-like hepatitis are very limited. When was this? 2024. This case report shows a possible association of these drugs with developing autoimmune-like hepatitis and cholelithiasis. Let's keep going. Severe liver injury caused by semaglutide injection. A 25-year-old woman received subcutaneous injection of semaglutide injection, 0.5 milligram, by herself for weight loss. She developed nausea and vomiting after medication, but did not pay much attention to. Probably not native English speakers. On the second week, so her second injection, semaglutide 1 milligram was injected subcutaneously. Symptoms such as nausea and vomiting were aggravated, followed by stomach pain and distension, which could not be relieved. Laboratory tests showed ALT, liver enzyme 1, 687, that's high. Aspartate aminotransferase AST, 809. ALK-phos, alkaline phosphatase, another liver enzyme, 167. Total bile acids, 178.8. If they're using the same markers as I do, the normal high bile in the blood is at 10. She's at 178.8. Total bilirubin, 106.3. They're mentioning these because they're out of range, folks. Direct bilirubin, 64, and indirect bilirubin, 42.3 micromoles per liter. After excluding causes like viral hepatitis, well, if you don't know, viruses are just toxicity anyway, autoimmune liver disease, obstructive jaundice, and concomitant drugs taken at the same time, acute liver injury caused by semaglutide was considered. Oh, that's so nice of them. And liver protective treatments were given. Due to poor therapeutic effects, artificial liver treatment was given once. I don't even know what that is. And then liver protective treatments were continued. I don't even know what that means. On day 17 of treatment, laboratory tests showed ALT 579. That's still super high. AST 583, ALP 180. Total bile acids 231. So she's even higher on total bile acids. Total bilirubin 344.8, direct bilirubin 233.8, and indirect bilirubin 111 micromoles per liter. After 6 months of treatments, the patient's liver function returned to normal with laboratory test results of ALT 56. This is still higher than I'd like it. AST 33, still higher than I'd like it. ALK-phos 99, total bile acids 2.7, total bilirubin 10.5, direct bilirubin 3.2, and indirect bilirubin 7.3. She took 2 injections. You remember the dose of it was 2.4 milligrams? She didn't even make it up to the full dose. 0.5, one time first week. 1 milligram, one time second week. 6 months of liver jacked up. Even when these doctors are doing whatever it is that they call an artificial liver treatment and then liver protective treatments. I don't even know what that means. 6 months. Semaglutide-induced hepatotoxicity, a rare case of drug-induced liver injury. Okay, let me talk about rare. Those of you who have been following me, you know about Accutane and isotretinoin, and I've gone over it with sacroiliitis, inflammation of your sacroiliac joint, your SI joint, the thing that chiropractors love to adjust in everybody every time they go in because everybody's jacked up there because everybody's vitamin A toxic. And in all the papers about isotretinoin, Accutane-induced sacroiliitis, they love to say, oh, it's rare. It's a rare side effect. It's a rare side effect. It's a rare side effect. And as you look into it more and you find that there are more than 33 papers that mention this in the title, you start to go, maybe this isn't so rare. Maybe they're all just repeating the same lie and nobody's willing to change it. And what do we fix here? We fix sacroiliitis all the time because it's vitamin A toxicity. What do we see happen here quite often in people? I do not promise weight loss. My goal here is not weight loss, but we see people start to lose weight and start to lose some of their strange fat deposit patterns because they are toxicity and bile problems. You're seeing here that they're giving these drugs to change the bile and they see weight loss, but then they see liver problems, okay? So it's all connected. We just try to do it to fix your body. They're trying to do it to make your body do what they want it to do. Okay, semaglutide-induced hepatotoxicity, liver toxicity, a rare cause of drug-induced liver injury. Oh, I could zoom a little. Yeah, that's cool. Okay. Oh, didn't I change the screen? Joe, isn't it on? This one? Let me look. There we are. Yeah, we're on the right one. Let me get back to it. There we are. Okay. A 67-year-old woman with morbid obesity status post-bariatric surgery. So she already got her stomach stapled or cut. Okay. presented with acute onset epigastric, that's like where your stomach is, abdominal pain, nausea, and vomiting. She had started taking semaglutide 2 weeks back for weight loss. Lab tests revealed significant acute transaminitis, that's elevated liver enzymes, ALT 1616, AST 3019. Like, we want this between, like, where I want it is between 10 and 26. 1600, 3000. Oh, no, semaglutide doesn't affect your liver. No, it doesn't. With mild elevation of alkaline phosphatase, 293. So again, why are they so bad at finding this? Bilirubin, serum albumin, prothrombin and lipase levels were normal. So the bilirubin was normal even after all of this. Liver function tests prior to initiation of semaglutide were normal. So it was all the semaglutide in 2 weeks that did this. Due to a concern for drug-induced liver injury, gosh, you think? Semaglutide was discontinued. Her transaminitis and abdominal pain showed significant improvement with conservative management. We hypothesized semaglutide-induced hepatotoxicity as the likely cause etiology based on clinical evidence and exclusion of other causes. Let me make sure there's nothing else in this paper. Yeah, that's it. Okay. Now, let's keep going. Oh, liver injuries are not, semaglutide doesn't hurt your liver at all. Doesn't mess with your bile. Okay, here we go. Progressive cholestasis, worsening leakage of toxic bile into the blood. Progressing toxic leaky bile into the blood, and bile duct fibrosis scarring closing shut. That's what biliary cirrhosis leads to, which is what causes, so the pipes get blocked, and then they cause an increase in the bile leaking into your blood. We have helped a woman fix her primary biliary cirrhosis, where her hepatologist could not find any evidence of it anymore. We have that testimonial on one of the live streams. We have multiple people whose hepatologist, their liver doctor, has discharged them because the reason they were sent into the hepatologist when they did their 6-month scan or whatever they do, their problems disappeared. We fix these problems that drugs cause and that vitamin A toxicity causes. We help people fix them. I don't fix them. You guys do the work to fix them. I'm just your guide telling you where to go and what to do and what to watch for. Oh, if you guys didn't know, there's a whole new article series on selenium in the Love Your Liver network that you may want to go check out. Dosing and all that stuff. So progressive cholestasis and biliary cirrhosis after initiating oral semaglutide. Report from the Drug-Induced Liver Injury Network. Oh, wait, so remember, they always do the apologetics first. They always claim that it's okay and it's good right before they tell you how bad it is. Semaglutide has little hepatic metabolism, so that means the liver doesn't detox it. Semaglutide has very little liver detoxing and is deemed low risk for causing drug-induced liver injury. Well, we're finding a pattern that says differently, aren't we? We present a case of drug-induced liver injury from the U.S. Drug-Induced Liver Injury Network. The case involved a 51-year-old man with type 2 diabetes who presented with jaundice, bilirubin in the blood, and acute on-chronic kidney disease 6 months after starting oral semaglutide. His liver injury progressed to biliary cirrhosis accompanied by nephritis, kidney disease, kidney inflammation that led to end-stage renal disease. Extensive evaluations, including liver and kidney biopsies, revealed no alternative etiologies. They could not find another excuse for why this guy got sick. It was the semaglutide. Cholestatic gene sequencing revealed heterozygosity for ABCC2 and DHCR7. He eventually underwent combined liver and kidney transplantation, all from taking a drug to help with his diabetes. Folks, once your liver starts failing, even if they can't see that it's failing, then the bile goes into your blood and it hits your kidneys. It starts damaging your kidneys. If your kidneys and your liver can't get rid of it, it goes out your skin. I would bet this guy had skin problems too. And then I love this where they say, oh, the gene sequencing, we looked at his genetics And then later it shows these genes which make him more susceptible to these problems. Well, if this is so obvious, then why aren't they testing for these in people before they put them on these toxins? Because they don't care. Now they're looking for an excuse as to why this guy got a problem and other people supposedly aren't. It's all just excuse making. So they can keep poisoning us with these compounds. Okay. Adverse effects of GLP-1 receptor agonists. Imagine that there's adverse effects. Oh, wait, let me make it a little smaller. Concerns have been expressed regarding the effects of these drugs on pancreatic and thyroid tissue, since animal studies and analysis of drug databases indicate an association. Animal studies and analyses of drug databases indicate an association of GLP-1 receptor agonists, semaglutide and the like, with pancreatitis, pancreatic cancer. You know that once you get pancreatic cancer, you're pretty much toast, right? And thyroid cancer. Wow. Animal studies and analyses of human drug databases show that these are connected. And yet the drug companies, you see commercials for this all over the TV. Oh, several meta-analyses failed to confirm a cause-effect relation. Buyer beware. You want to believe the pharma cartel that they're safe? You're going to get the consequences of that poor decision, in my opinion. Let's keep going. Rhabdomyolysis associated with semaglutide therapy, a case report. Rhabdomyolysis is when you're eating away your muscles so fast that the myoglobin part of the muscle is leaking into your blood and causing your kidneys basically to get gunked up so bad that they can't do their jobs and they're getting damaged. Oh, I got to share my screen. Got it. There it is. This report describes a case of a 47-year-old woman with myalgias, muscle pains, weakness, and elevated creatine kinase associated with semaglutide therapy prescribed for weight loss. That's one of the tests that they do for rhabdomyolysis, creatine kinase. Her symptoms and laboratory markers were consistent with rhabdomyolysis and resolved after discontinuation of semaglutide. Upon re-challenge at a lower dose, symptoms recurred, and urinalysis was consistent with myoglobinuria, myoglobin in the pee. Another indicator of rhabdomyolysis. Symptoms again rapidly resolved upon discontinuation of the medication. It is imperative, that's very important, for physicians to recognize semaglutide as a possible cause of muscle pains, myalgias, and rhabdomyolysis in clinically suspected patients. To the best of our knowledge, this is the first reported case in the literature and may be specific to semaglutide rather than a class effect of glucagon-like peptide agonists. We wouldn't want to blame the other things as following the same pattern. So how dangerous is rhabdo, as they call it? Back in the CrossFit days, they called it rhabdo. I remember that. And yes, people are still going down with rhabdo all the time. The more toxic you are, folks, the more likely you are to get rhabdo. Okay? Your detox slows down. I mean, part of this is detox. Rhabdomyolysis is characterized by clinical symptoms consisting of muscle pain, weakness, and tea-colored urine, or sometimes they say Coke-colored urine because it gets real bad. Not all patients will have symptoms, and up to 50% of patients can be asymptomatic. Well, that sounds kind of dangerous. Regardless of the underlying causes, the global mortality rate for rhabdomyolysis is as high as 8%. That's 1 in 12 people dying from it. Given that this condition is caused by the breakdown of muscle cells and the release of their intracellular components, creatine kinase levels are expected to rise to 5 times the upper limit of normal or higher. Multiple drugs have been identified as a cause for rhabdomyolysis. However, GLP-1 agonists have not been previously associated with the condition in the literature. So this lady gets to be the first. 2023. Okay, now let's get into liver and bile duct and gallbladder diseases associated with these drugs. And this is when? 2016. This was back in 2016. Association of bile duct and gallbladder diseases with use of incretin-based drugs in patients with type 2 diabetes mellitus. And they say here, for those who are saying, well, what's incretin? To determine whether the use of DPP-4 inhibitors and GLP-1 analogs, receptor agonists, is associated with an increased risk of increased incident bile duct and gallbladder disease in patients with type 2 diabetes. The use of GLP-1 analogs was associated with an increased risk of bile duct and gallbladder disease compared with current use of at least 2 oral anti-diabetic drugs. In a secondary analysis, GLP-1 analogs were also associated with an increased risk of cholecystectomy, that's gallbladder removal. The use of GLP-1 analogs was associated with an increased risk of bile duct and gallbladder disease. Oh, but it doesn't affect your liver. Sure. Okay, let's keep going. The association of glucagon-like peptide-1 receptor agonist use with risk of gallbladder and biliary diseases. Another paper. A total of 76 randomized control trials involving 103,000 patients, age 57.8 years on average, 42,000 women were included. Among all included trials, randomization to GLP-1 RA treatment was associated with increased risks of gallbladder or biliary diseases, specifically gallstones, gallbladder inflammation, and bile duct biliary disease. Use of GLP-1 receptor agonists was also associated with increased risk of gallbladder or bile duct diseases in trials for weight loss. They didn't tell you about those in the commercials, did they? And for type 2 diabetes or other diseases. Among all included trials, GLP-1 receptor agonist use was associated with higher risks of gallbladder or biliary diseases at higher doses. The more poison you take, the more it poisons you, compared with lower doses, and with longer duration of use. The longer you take the poison, the more it accumulates, the more you get poisoned, compared with shorter duration. This systematic review and meta-analysis of randomized controlled trials found that the use of GLP-1 RAs was associated with increased risk of gallbladder or biliary diseases, especially when used at higher doses for longer durations and for weight loss. For weight loss specifically, they mention that. The more you take, the longer you take it, and if you're taking it for weight loss, you are more likely to ruin your gallbladder and bile duct, which means it's ruining your liver along the way. Because your bile is getting so toxic, it's damaging your gallbladder and your bile ducts. Okay, so now let's get into what does this do to your stomach? Let's hit that. First, we already went over some of this, gastrointestinal adverse effects associated with semaglutide, a pharmacovigilance study based on FDA adverse event reporting system. Well, it's nice that all these, I think, Chinese guys studied our FDA system. I already went over the half-life, semaglutide, a novel GLP-1 RA with an extended half-life of about 1 week. After the approval of semaglutide, the post-marketing concerns have been raised about its long-term safety and tolerability for clinical use. The most common adverse events reported with GLP-1 RAs were gastrointestinal disorders, such as nausea, diarrhea, vomiting, and abdominal pain. We understand that these are all connected to bile. In addition, GLP-1 RAs may be associated with an increased risk of acute pancreatitis, bile going up into the pancreas, and thyroid cancer. And the FDA has warned the public about these adverse effects. Well, maybe if you're taking semaglutide, were you ever warned about it? A systematic review and network meta-analysis published in 2014 revealed that all GLP-1 RAs dose regimens distinctly increase the incidence of gastrointestinal adverse effects compared with placebo or conventional treatment. Since 2014, we're 10 years later. Oh, so Joe, this is, let me see. This is the one right after the brave search for semaglutide gastric emptying. Here, I'll put it in the Telegram for you. You got it. Okay, great. So there's that one. Let's go into, did I not show this one? That's this one, if I didn't show it. Okay. Now let's go into the food sitting and rotting in your stomach, which people try to deny. I've seen people out there that are like, that doesn't happen. It does. It's in the research. It's not hard to find. Influence of semaglutide use on the presence of residual stuck sitting there gastric stomach solids on gastric ultrasound. So when they ultrasound the stomach, they found residual food. A prospective observational study in volunteers without obesity recently started on semaglutide. 20 adults voluntarily enrolled, giving a total of 10 participants in each group in the supine position. So they're laying on their back. 70% of semaglutide participants and 10% of control participants had solids present on gastric ultrasound. In the lateral position, so on their side, 90% of semaglutide participants and 20% of control participants had solids identified on gastric ultrasound. 2 hours after drinking clear liquids, the two groups did not differ in the lateral position, but in the supine on their back position, 90% of control group participants were rated as empty, compared with only 30% of semaglutide group participants. How long did they give it to them? Okay, an 8-hour fast. So they had them fast for 8 hours in those taking the GLP-1 receptor agonists compared with controls. And then they had some water, and 2 hours later, they did the ultrasound after that. So this is like a one-day study. I'm not going to go look up when they gave them the semaglutide. But you'll see, in the real world, it's still all there. Semaglutide delayed stomach emptying and intraoperative, as in within an operation, pulmonary aspiration. So what they're talking about here is, so you may have heard about if you don't eat before a surgery where they put you under with anesthesia, because sometimes you vomit up what is in your stomach and then you can choke to death on it. So they're saying this is looking like a problem. A 42-year-old patient with Barrett's esophagus, we'll go over that in a second, underwent repeat upper gastrointestinal endoscopy and ablation of dysplastic mucosa. So they're blowing away, they're cutting out using a laser, whatever. They're destroying this dysplastic, as in potentially cancer, mucous membrane in his esophagus. Okay, so they sent the camera down, and they were destroying this dysplastic mucosal tissue, the lining of his esophagus. 2 months earlier, the patient had started weekly injections of semaglutide for weight loss. Well, okay, so let me tell you what can cause Barrett's esophagus. Those of you who know, an excessive amount of vomiting. An excessive amount of vomiting can cause Barrett's esophagus. 2 months earlier, the patient had started weekly injections of semaglutide. One of the most common side effects of semaglutide is vomiting. Gosh, do you think this is all connected? Despite having fasted for 18 hours and differing from the findings of prior procedures, endoscopy revealed substantial gastric content. 18 hours later, the food was still in his stomach, which was suctioned before endotracheal intubation. Food remains were removed from the trachea and bronchi using bronchoscopy. The patient was extubated 4 hours later and remained asymptomatic. Why is this important? Patients using semaglutide and other GLP-1 agonists for weight management may require specific precautions during induction of anesthesia to prevent lung aspiration, so sucking food down into your lung from your stomach after you barf it up. Is that a one-time thing? Nope. Regurgitation or barfing under anesthesia in a fasted patient prescribed semaglutide for weight loss, a case report. We describe an unexpected case of regurgitation of a large volume of gastric contents upon induction of general anesthesia in a non-diabetic, non-obese patient, despite, so this is like a normal person taking semaglutide for a little bit of weight loss. Despite a long preoperative fasting period, 20 hours for solids and 8 hours for clear fluids. This patient had no traditional risk factors for regurgitation or barfing or aspiration, but was taking the GLP-1 RA semaglutide for weight loss and had last taken the medication 2 days before their scheduled procedure. Well, what's the half-life of it? It's a week. Patients taking long-acting GLP-1 RAs such as semaglutide may be at risk of pulmonary aspiration under anesthesia. We propose strategies to mitigate this risk include holding the medication 4 weeks prior to a scheduled procedure when feasible and considering full stomach precautions. Remember how long it took to clear it out? It was 5 weeks. They're trying to help people not die by choking on their own vomit when they go under anesthesia. Non-diabetic, non-obese. Normal people taking this drug because they're too lazy to work on weight loss the normal way. Now let's get into what they add. I think I may have gone over this in the live stream before, but we're going to hit it again for those in the back. Look at this title, Gastrointestinal or your gut permeation enhancers for the development of oral peptide pharmaceuticals. Do you know what this means? It means they are going to cause leaky gut with toxic compounds so that you can absorb the semaglutide through your intestines to poison yourself further. That's what gastrointestinal permeation enhancers, permeability. Intestinal permeability is another term for leaky gut. In 2019, why do they want to make these things so you can take it in a pill? Because a lot of people don't like to inject. So they have to figure out how to give it to people in a pill, and they're going to give it to them every day instead of once a week. In 2019, the Food and Drug Administration approved an oral dosage form of semaglutide developed by Novo Nordisk Rybelsus. I'll check on it, Joe. For the treatment of type 2 diabetes, let me just look here. Joe, I think we're going to get all of them. Anyway, we're back on this one. So they also use it for another drug. These two oral peptide products have been a significant success. However, a major obstacle to their oral delivery remains the poor permeability of peptides through the intestinal epithelium. Therefore, gastrointestinal permeation enhancers are of great relevance for the development of subsequent oral peptide products. Sodium salcaprosate, SNAC, so just remember SNAC, and sodium caprolate have been used as gastrointestinal permeation enhancers for semaglutide and octreotide, respectively. Rybelsus oral semaglutide. It was the first oral peptide drug based on the permeability enhancement strategy. This is really important. Oral formulation of semaglutide with sodium salcaprosate, SNAC, as the permeation enhancer. SNAC is a synthetic N-acetylated amino acid derivative of salicylic acid. Just remember, salicylic acid. It's a derivative of it. Okay? We're going to go over salicylic acid. Hold on, Joe. Let me see what you were looking at. Application of permeation enhancers. I think that's the next one we go over. Yeah, here we are. Okay. Another paper on it. Application of permeation enhancers in oral delivery of macromolecules, big molecules. An update. The application of permeation enhancers to improve transport of poorly absorbed, why would your body poorly absorb it? Because it doesn't want it. Active pharmaceutical ingredients across the intestinal epithelium is a widely tested approach. SNAC has, however, been successfully used in a marketed oral vitamin B12 supplement, Elogen B12, so you can get your leaky gut to get your B12, and more recently was shown to improve oral absorption of semaglutide in phase 2 trials. It is unclear why gastric emptying, stomach emptying, does not occur in patients receiving oral semaglutide. although it is possible that the peptide could slow gastric emptying. Let me see if I can find the, wait, why isn't it giving me my find? Okay, let's do 1%, 0.0%. Well, okay, maybe it's not on this paper. Let's just do search for percents. Well, okay, what I saw in another paper, let me just go over that, was that when this snack permeation enhancer was used, the oral absorption of semaglutide was still only something like 0.4% to 1%. So about 0.5% of it that you took in was absorbed up to 1%. So 0.5% to 1% of the pill you took was absorbed. So 99 to 99.5% of it is not absorbed and sits in the stomach. So they have to give basically 100 times the dose of what gets in your blood to get it to work. So what do you think happens to all that extra semaglutide that's not getting into your blood? Well, it's just affecting your stomach. Oh, it's unclear why stomach emptying doesn't happen. I just want you to read that. It is unclear. They know that it doesn't happen. It is unclear why gastric emptying does not occur in patients receiving oral semaglutide. Although it's possible that the peptide could slow gastric emptying. What do they think is causing it? Do you understand that they say this so they can lie to you? It's right in their face. So let's keep going. Now let's go into what salicylic acid is and how they're being so nice to you to give this to you. So remember, the snack was a derivative of salicylic acid. Salicylic acid is an organic compound with the formula. Here's the formula. It is a colorless or white, bitter tasting solid. Oh, bitter. That means it's a poison, right? That is a precursor to and a metabolite of acetyl salicylic acid. Okay, so it's related to aspirin. You can turn salicylic acid into aspirin, and aspirin also breaks down into this. Do you remember that aspirin could cause ulcers, eating holes in things like your stomach? The mechanism of action. So this is the AI summary that Brave did. So this is from another website. Salicylic acid works by loosening the glue, quote, glue that holds skin cells together, supporting natural shedding of dead cells. Folks, does this sound like anything we talked about before, like a chemical peel, like a yellow peel, like retinoic acid eating away at your cells? Salicylic acid loosens the glue that holds skin cells together. So what about the intestinal cells? Gosh, if they weren't held together, what would that cause? Do you think it would cause leaky gut? Do you think that would help this giant molecule penetrate more into your blood? Do you realize that they can't make you absorb too much of the molecule, because then they would absolutely eat away at your entire gut lining? They can only do so much of it. So they can say that it doesn't cause problems, but it does cause problems. So, natural exfoliation, chemical exfoliation, like a chemical peel to your guts. Now, I know some of you don't like Wikipedia. Wait, what did I miss? Oh, no, I did that one, Joe. I did that one. Some of you don't like Wikipedia, but this is a pretty straightforward explanation. This was what we went over before. Salicylic acid is a plant hormone, and it has been listed by the Environmental Protection Agency Toxic Substances Control Act Chemical Substance Inventory as an experimental teratogen, birth defect causing. Wait, retinoic acid causes birth defects. Wow, salicylic acid causes birth defects. Retinoic acid is a chemical peel. Salicylic acid loosens the glue between cells and causes exfoliation or skin cells to fall off. Salicylic acid as a medication is commonly used to remove the outermost layer of the skin. As in, cotton pads soaked in salicylic acid can be used to chemically exfoliate skin. Chemically exfoliate. This is what, some of you may be using this for acne still, but it used to be used a lot for acne. Was it OxyClean? Or not OxyClean, but those acne pads. People used to rub on their face. So they're using a tweaked version of salicylic acid to basically cause leaky gut in people. Do you think that's going to cause problems? Okay, so we want to just use a, yeah, I think that's it. I think that's it. So those of you out there, some of you are going to say, I saw somebody talking about retroglutide and terzepatide, and they're all like, oh, it's going to be so much safer. And oh, you know why they do this? They bring out new ones because there's not data on them to show that they're toxic yet. They pad their tests, they self-grade their tests on the studies, I mean, so that they look good enough for the FDA to approve them. Remember, the FDA does no studies of its own. So the pharma cartel companies do their studies for the FDA, submit their self-graded test to the FDA saying it's safe. The FDA, rubber stamps it. Oh, that's okay. That's great. We're going to look at the semaglutide stuff that we approved it. And we're going to say, well, the semaglutide looks safe enough. So these other products that are like it, we're going to go with it. And we're going to say it's terrible. They're going to let people poison themselves because now they have. Do you guys realize all the other weight loss drugs that have come and gone because they were disasters? Why do people think that this is going to be any different? It's still the pharma cartel. You still don't want to trust them. They've still screwed up people every time they try to do this. There is no easy way out of this. It may look like that at the start. There is no free lunch. You are concentrating the toxicity in your fat cells when you are losing it with this. So that is that. Joe was saying, Joe, I think I went over that. I went over that link earlier. So I think we're good on all the links. So I'm going to stop sharing my tab. And then I'm going to get to the super chats. So we're going to go through the super chats first. It's 11:11 right now. Oh my gosh, on my computer. Oh my gosh. And then we'll go into the super chats. Oh wait, hold on. Oh well. Somebody's calling me right now and I'm not going to answer it. I swear, I tell my whole family and everybody, I'm like, Tuesdays, don't call me, don't text me, don't do anything because it's my live stream day. And when do they send me the most texts? I swear, they all do it right during my live stream. Okay. So we got CE. Thank you for the super chat, CE. You were saying your opinion on L-tryptophan, greatly appreciated. So we do want to, so tryptophan in food, especially, well, okay, let me say, I think the tryptophan in turkey thing is why it makes people tired is a bunch of BS. There is tryptophan in turkey, but there's tryptophan in every other muscle meat you eat. And so like the idea that turkey makes everybody so tired on Thanksgiving is a bunch of garbage. It's mainly that people just eat too damn much on Thanksgiving, and that's why they're tired. They eat like garbage. Their body says, I want you to stop using your muscles and sit down and lay down so you can actually digest all this stuff that you just put in the stomach so we can put all our blood to your stomach instead of your muscles. That's so supplementing tryptophan. Oh, the thing you should know about the scare about tryptophan in the past was the tryptophan, I believe, was being made by a bacterial process. There was one company in Japan that made tryptophan with a bacterial process, and that made the toxic tryptophan that caused, I forget what the syndrome was, but that's what made the toxic tryptophan, and that's what caused tryptophan to get banned for so long. And then finally, the FDA came around and said, oh, yeah, I guess it was all this one company that caused the problem. So now we can sell tryptophan again as a supplement. Okay, so tryptophan does turn into nicotinic acid. It also turns into 5-HTP, 5-hydroxytryptophan. It also turns into serotonin. The best thing I can say about tryptophan is it gives your body the choice of which of these pathways it goes down. Like 5-HTP, 5-hydroxytryptophan goes straight into serotonin. So if you take 5-HTP, you could cause excessive serotonin issues because there's no escape valve for it. Whereas tryptophan would also have the escape valve of going down the niacin pathways. So that is beneficial. I can't remember if I tried tryptophan or not. There's supposedly the studies from like, what are they, like 1980s or 1970s, where a big dose of tryptophan before bed would supposedly increase growth hormone. I don't know. I feel like I got some tryptophan and I tried it and I didn't notice anything from it. Actually, I think after a while, the biofeedback that I was doing said it wasn't that great for me. So I kind of stopped taking it. I don't know. Tryptophan is kind of just, it's one of those things. It's an amino acid therapy, so it's definitely a try it and see, like glycine and taurine and like these other amino acids that people can experiment with. You can try it. If you feel better from it, that's fine. If somebody absolutely would not take flush niacin because they're too big of a baby about the flush, then they might either eat some more meat to get tryptophan from the meat, or they might try a tryptophan supplement. I'm not advising it. People out there hear me mention anything about taking a supplement, they say, Dr. Smith said to take this. No, I said you could try it. I don't know why people twist my words. It's pretty straightforward how it comes out of my mouth. I say things very carefully on purpose. This is why I don't tend to joke a lot on my Twitter. It's because I will not risk people misinterpreting what I say. So yeah, if somebody wanted to try it, you could. Do I think tryptophan is any magic bullet? No. But could it have a place for some people? Sure. Why not? Yeah, that's what I got on that one. Let's see. Another one from CE. Fight or flight state. Is bile dumping constantly during this state? Increased toxic blood circulation during that state? Well, it's probably somewhat of a duration, so almost like a duration paradox, where there can be a dual phase of it. And what I mean by that is, I believe I've gone over research on adrenaline. Well, you have to think of, could there be a short-term effect and could there be a long-term effect? You know how like people will have a couple drinks of alcohol and they feel great. They feel like they're on top of the world, and then they have a hangover later. So see, the alcohol can have a multiple phase effect. So could adrenaline and cortisol have kind of a biphasic effect where, let's say at the start, when you get stressed, acute stress, short-term high stress, it makes sense that it might actually stop your bile production for a short period of time, because your body wants, you dump all these stress hormones, and the point is to not make you feel worse. The point is to help you feel better so that you can do whatever you need to do, whether it's fight or flight, hopefully not freeze. But so you do all these things. It's kind of like my theory of why people get constipated when they go on a vacation or they go somewhere new that they didn't, whether they plan on it or they didn't, your body doesn't know the difference. But if you go somewhere new, it's kind of like if we thought about kind of the older design of humans, like why would people get constipated when they pick up camp and move? Because not pooping for a day or two or three could actually be beneficial if you had people, I don't know, chasing you, or if you just want to move camp and pooping is not going to help. It's just going to slow everybody down. And it's not that necessary if it's only a once in a while thing. So if you were, and then it would also be really bad to poop in terms of having others track you, right? Poop is pretty easy to track. It's got a lot of scent to it. So it makes sense that if there was a stressful event like moving camp, the body might get constipated. So acute stressors, the dump of adrenaline, noradrenaline, also known as epinephrine, norepinephrine, and cortisol may very short-term slow bile dumping and production. But then most of us know after that stressful event, you start to feel pretty bad, which would be like what happens in car accidents, right? People get in a car accident and they dump all this adrenaline and cortisol and they feel relatively fine for the period of time after the car accident because they are numbed by all their own internal chemicals. But then they say the next morning when you wake up, your neck's going to hurt. You're going to hurt all over. Well, why didn't they hurt all over before? Well, because they were numbed from the adrenaline and cortisol, and they may have not dumped bile. Why do they feel bad the next day? Well, you took away the stress hormones, and they probably dumped some of the stored up bile. So you can have like a biphasic effect, or you could just remove the suppressor. Like if cortisol and adrenaline suppressed bile, and then you remove them, they get processed out, then you start dumping the bile that built up. Kind of like when people go on vacations and they're constipated, and then eventually those whatever the cause of the constipation was wears off, then they got 1, 2, 3 days of poop they got to get out, so they poop a bunch of times in that day. So Baptized in Fire asked, when will Sunfiber be back? I'm just going to answer this real quick. Once I get home to Tucson, the shipment of Sunfiber will be coming to my house, and we will get it back up on the website. So as I've been telling people, just to be safe, it will be back by the end of November. Hopefully it will be back before then. I should be getting home on Friday. So don't email Julie. We will announce it everywhere when we have it, but it should be soon. There's nobody at my house or at where we take the deliveries to take it right now. So it's all made. It's sitting at the manufacturer. We just don't have anybody who can pick it up right now. So yeah, that's the problem right now. It's finally made. Okay. Elijah asked, I saw his question. There it is. Been feeling sick for a week. Is there any supplements or changes you can make or take to get better quicker, or do I just ride it out? Well, inside the Love Your Liver program, there is the what do I do if I get sick little course. That is available there. I think it's $20. The biggest thing, okay, so the biggest thing that I want to go over first, which is the most common thing, is when people push agitators too hard. When people push the detox too hard, you will feel bad. You are leaking an excess of body. Remember, we're all here because if toxic bile theory is true, we're all here because we are leaking toxic bile into our bloodstream, and this is what caused our symptoms in the first place, which is why we are here. If you are going through the program, as you go through the program, as you become less toxic, remember how I tell you the more toxicity you have, the slower your detox. And generally the less and slower your bile production is overall, but it's so toxic that it causes more damage. So you can still be releasing less, but it's extra toxic. So as we do this process, you are going to make more bile overall. Over time, that bile is going to be less toxic, but also over time, you still have the leaks. So we do have to, over time, we have to make the bile less toxic so that the body can heal the leaks, so that it's not leaking. But along the way, if people start pushing bile dumping too hard by, let's say, exercise or sun or sweating or stress or too much soluble fiber or too much of other things that might cause a person to dump bile, too much of the zinc or selenium or molybdenum or lactoferrin or niacin. Remember, all these things help you to detox, which means that you become less toxic, which means you start making more bile and dumping more bile in the right, hopefully in the right direction, which is your intestines to going out your poop. But you're not all better yet, which means you're still leaking bile. So if you start dumping more bile, even though it might be a bit less toxic, but remember, your liver has years worth of crap stored up in it. So if you push things too hard, if there is anything, Elijah, especially that if you've been, let's say you've been quote unquote sick for a week, if there was anything you changed in the week before you got sick, that is like increasing your agitators, then that's the first thing you need to back off on. Like it could have been like, I don't know, you started eating more beans, or you added oats, or you added, I don't know, sun fiber, you increased your lactoferrin, or you've been like the biggest one, the lactoferrin cold, or what I call now the lactoferrin creep, which is, let's say you were taking lactoferrin, you're increasing your dose slowly, and then you start saying, I'm feeling sick. That might very well be the lactoferrin creep, the lactoferrin cold. This is why I write these detailed instructions on the lactoferrin, so people can hopefully avoid this. Usually people have to do it to themselves and feel it before they realize, oh, this is what he's talking about, and then they back off. Now, this could happen with the flush niacin too. This could just happen as you get better. And so sometimes as people get better, they have to drop their doses of these things because the stimulus to increasing your detox rate is too much for you to handle and you've got symptoms. Otherwise, I would not try to increase. Generally, we don't try to increase supplements during a time like this. You would potentially look at decreasing things, decreasing the agitators that I mentioned, anything that you introduced in the week before you got sick, resting binders like charcoal. So not necessarily more soluble fiber. Soluble fiber is a binder, but soluble fiber can increase bile dumping. So you have to be real careful with that. But more charcoal, magnesium baths, if you like them, that really helps me with the muscle aches I would get during colds or flus back in the past. Doing things to help your breathing, whether that's like inhaling steam or other things like that. But yeah, I go over hydrogen peroxide in the ears and some other things in the What Do If You Get Sick program. I go over multiple things in there. And but the best thing to do, if you're able to, is to just ride it out. You can do things to try to slow it down, but I want you guys to remember something. This is very, very important. A cold or a flu. So this is the first assumption. The first assumption is that you, Elijah, or anybody else is not causing this problem by pushing agitators too hard or pushing detox too hard. I cannot judge that for your situation. But if you are pushing agitators too hard, well, it's the same end point. But if you're pushing them too hard, then you're doing this to yourself. So if you want it to be less, then do less. Reduce these things. Okay. If the cold or the flu was triggered by what you're doing, just going along, and your body decides it's dumping more toxic bile than it normally does, and some of it's leaking into your system and causing you these symptoms. This is the challenging thing for people to understand and not make a mistake about worsening. If you feel bad from pushing detox too hard, if you are having symptoms of excessive detox and bile dumping, technically you are detoxing faster than normal, because now you've got the bile hopefully coming out in your poop. You've got bile going in your bloodstream to your kidneys, which is, your kidneys are not happy, but they're doing their job. And you possibly got bile coming out in your skin and the other toxins. So all the toxins that are in bile, it's going through your system, which is why you have symptoms, but you're also detoxing overall more. But you're suffering. So if someone comes here, anyone comes here complaining of their symptoms, and they say, but I want to detox faster, and you told me that this is faster detox. It is, but you're suffering. So and this is not just you, Elijah, this is for anybody. If you're coming here to bitch that your symptoms are bad, And let's say you're put, and so like Elijah, this is not you, this is anybody. This is directed at anybody doing this, because this is anybody who pushes too hard, thinking that, let's say it's good, and then they're coming bitching about their symptoms. If you're causing it to yourself and you know this, don't come and complain. You did it to yourself. I can't make it go away without you reducing it. And then people go, but I don't want to slow down my detox. Well, you want the symptoms to go away, and one is causing the other. So it is on the person to fix that. Now, I recently had a quote unquote cold. It was mainly sinus stuff. It was a lot of snot. I had so much snot coming out of me. And I tend to be, where do I detox through? I detox through my sinuses with a lot of snot. That's one of my major ways of detox. Like even back when I was married, my ex-wife said, you're just kind of a snotty guy. Like you're just phlegmy and snotty. And I was kind of like, at the time I was like, no, I'm not. And then I thought about it later and I went, oh yeah, that's kind of, so some of you will know where you detox. You might detox through your skin and have real BO problems. You might detox through your ears and have real earwax problems. You might detox through your tear ducts where you get lots of sleep, that eye boogers, that stuff. You may detox through your scalp where you have like seborrheic dermatitis, where you've got like yellow, oily stuff coming out through your scalp. So a lot of times we know, like if you tended to have irritable bowel and lots of diarrhea, you may be getting rid of lots of toxic bile through your guts, but it's causing you problems. Like it's so much that it's a problem. You might have hypothyroidism because you dump your bile into the bloodstream and it negatively affects your thyroid. So anyway, most of us know, once we think about it, we know our detox routes. And that's where you tend to have issues. And when you get sick, quote unquote sick, that's where it comes out. So whatever triggered mine, there is, okay. Do I believe in viral theory? No, virus theory is complete garbage. It is not viruses that are why these things spreading. It could be weather changes. It could be EMF changes. It could be, shared stress in a household. It could be shared food patterns in a household. It could be shared toxin exposures in a household or at work. Right? Remember, if you spend 8 hours a day at work, you're sharing that same pattern with everybody there. It could be, I don't know, shared like cultural stress, like, oh, I don't know, maybe the election. Whether you feel stressed about it or not, we do pick up on things. So the reason why I want to say that it doesn't have to be a virus, it never had to be a virus. Certain examples. Why does one person want to yawn when they see somebody else yawn? Did they transfer a virus? Was any physical matter transferred? No. You saw somebody else yawn. Your body decided to yawn. Why is that? Why would we share that pattern so quickly? Why, when you smell or hear somebody else throwing up, do a lot of people start to get nauseous and maybe even throw up themselves? Did one person ingest the vomit of the other? Why did the smell trigger that? Possibly because a strategy of humans would be, if you see somebody, it's not normal to be vomiting. So if you see somebody else vomiting, they're probably in your tribe and you probably ate the same food as them, and their body is throwing it up saying, this is toxic. So your body starts saying, maybe I should throw up the toxic food that's in my stomach too, because we ate the same thing. It's a protective reflex that we are programmed with. Why do women's menstrual cycles sync up the longer they stick around each other? Are they exchanging physical matter for this to happen? So these patterns where people share these reactions do not require viruses. So why do we assume that if people, quote unquote, get sick around the same time, that they are sharing some little protein that doesn't do anything actually? Virus theory is just complete trash. Just viruses mean toxicity. So could it be also a tribal thing that if one person starts a detox process, which we call a cold and flu, that other people see it or catch on to their, if you want to call it, vibe. You know, you can sense that something's wrong. You can tell if somebody's sick. What if your body starts going, maybe I'll do a detox cycle too. Remember, being sick is a detox dump. It's not something, if you shut it down, you're shutting down detox. Your body's saying, I want to get rid of this crap. So if you do things to shut it down, you know, you do the silly things like vitamin D and quercetin and all the other, the elderberries, which are full of polyphenols. People do all these things to shut down their detox so that they're not, quote unquote, sick. And then they start having to do more and more of these things over time because the body says, I really want to detox and you keep shutting me down. So we're just going to keep getting sick. You know, the beatings will continue until morale improves. Well, the sicknesses will continue until your toxicity improves. We should save that one. Yeah, put that on the, what is it? The quotes from me. The sicknesses will continue until the toxicity decreases or something like that. Anyway, you could look into, I'm going to be, so I don't know if you guys know, but I just posted on Twitter the other day, I had another of my videos taken down from 2018, which I believe it was an unlisted video. So it's not even on the main internet, but they took it down, a 6-year-old video, because I said mean things about the pokies in general. So this is even before the coof. So I was saying things that went against the WHO and about their pokies, and they took it down. So fun stuff. And I appealed it and they said no. 6 years ago. But yeah, so anyway, doing things. So this is another thing. So some people, and I've tried this before, some people have tried, they thought, oh, well, I'm detox dumping. I'm going to go to the sauna and I'm going to go do I'm going to take a bunch of flush niacin and I'm going to go extra, walk on the treadmill or bring up a sweat. And then I'm going to go get in the sauna and I'm going to flush this detox out faster. Right? I don't think it works. I think it makes you sicker. I've tried it. I felt worse after a couple days. I thought I was getting out of it, and then it just slowly came on. So I don't do that anymore. I let the body decide how intense I'm going to do it, and generally I'm trying to relieve things. Generally, we just want to do things to help yourself feel better. Whether that's like if you got a bunch of sinus stuff, maybe you're doing a sinus rinse like the Navage or a Neilmed. Neti pots are just such old technology. They just don't help. They don't rinse enough stuff out. There's not enough pressure. You're just pouring water through your nose. It doesn't work very well. If you get a Neilmed or a Navage and you try it, you will see that neti pots don't really do much. But so if you have sinus stuff, you could do sinus rinses. If you want to look into the universal antidote, it is 3 letters. There are variations of it with different 3 letters. I'm not going to say them here because I'm not going to get it taken down. I have information in the Love Your Liver program about this. But yeah, if you wanted to look into that certain compound, you could. Some of you might say what it is in the chat. Some of you know exactly what I'm talking about. I'm not going to say it because I want this video to stay up. And when you see the mainstream go against a compound so much, you know that it's doing something. So this is what some people have done. I think I talked about this a week or two ago. When you have a cold or a flu and you want it to go away faster, you have basically 2 options. You can increase the rate of oxidation, or you can decrease the rate of oxidation. We don't tend to want to decrease the rate of oxidation because this tends to involve antioxidants, which slow down your ALDH and your oxidative detox pathways. So then this is things like, megadosing vitamin C. or taking elderberry, full of polyphenols, taking these brightly, these magical berry concoctions. Or acerola, whatever. We don't necessarily want to do that, but I do have a live stream all about if somebody chose to use high-dose vitamin C to shut down their detox, which we're talking about colds and flus, you could do that. Is it a good first choice? No, not in my opinion. Then there is if you wanted to increase oxidation. This is to be done when you are sick or have an issue only. It's not to be done on a daily basis, but this would be things like that universal antidote I mentioned. This would be things like colloidal silver. This could be things like ozonated products, ozonated oils, other ozonated products that are out there. This could be something like applications of hydrogen peroxide, like I talked about hydrogen peroxide in the ears. That is an amazing little trick, and it can somehow prevent people from getting as sick. If you do it very soon on when you are getting, quote unquote, getting sick, you only get like half as sick if you do it. I swear, it blows my mind. Anyway, I would suggest if you wanted to do something to try to shorten it, I would suggest the increasing oxidation first over the decreasing it. And the decreasing oxidation would only be like if you were so sick you had to do something about it, or the increasing oxidation did not work and you're just like, I have to get better to go to work, or I have to get better to take care of my family, or whatever, where it's like you need to make a decision. It's not just like, I'm sick, I want to feel better. It's like you need to do it for some other reason. So that's what I got on that. Okay, so Joe, do we have anything else? I mean, you could try, Elijah, if you do well with zinc. So this is the weird thing about zinc. Some people, when they feel sick, they increase their zinc, and they feel better. Some people, if they were sick, they increase their zinc and they feel worse. You wouldn't know which way zinc pushed you unless you tried it. When you're sick, what happens when you're well doesn't tell you what's going to happen when you're sick. Austin's saying, thank you for the super chat, Elijah, and thank you for the super chat, Austin. He's asking, heavy chest. Hold on one sec. Okay, so heavy chest, more than 175 milligrams niacin, detox symptom. Well, so are you saying, did it not happen until that dose? I mean, the general advice here would be, if you notice something that, if you got up to that dose of niacin and you noticed a negative symptom, then that symptom you would want to, if you want to avoid it, then you would reduce the dose of whatever caused it. This is just, it's the old, doc, it hurts when I do this. Well, then don't do that. It's pretty straightforward. Okay, Austin said, correct, it didn't happen until that dose. So I would just go down to a dose that didn't cause it and stay there longer. Yeah, absolutely. So you like when you think of the cold or flu or the coof, and there was all these respiratory symptoms and there was all these lung issues, retinoic acid, vitamin A dumped out of the liver, can cause lung symptoms. One of the things that nicotinic acid, aka flush niacin, since it provides NAD, which is the gasoline for your detox pathways, particularly ADH and ALDH, you could, in theory, produce a little more retinoic acid than before. And if the retinoic acid was affecting your lungs and you didn't feel good on it, then you can just reduce the nicotinic acid until the dose that didn't cause it, and then stay there for longer. And then when you feel better, try going up in dose again. And it may just not happen at all. But yeah, it's probably a bile dump and what's in the bile getting into the bloodstream. Yeah. Okay, so he said, listen to Austin. Austin's a very good listener. Austin said, I thought that exactly when it happened. Doc, it hurts. If it hurts when I do this, don't do that. And he said, I'm back down to 150 milligrams. Thank you. So thank you, Austin, for demonstrating how to follow the guidelines that I hammer on over and over and over again. Yes, thank you for doing that. I love when people demonstrate that the advice works, right? So Elijah, if you change anything in that week before, that'd be a great thing to back off on. If there was anything that you can pin down on it, like I've seen stuff where I tried experimenting, like the amino acid thing. I started experimenting with glutamine for a while with the niacin, and I tried it, and within 4 days, I could tell that, I'll put it this way, my male hormones were not doing as well as they were before. I stopped the glutamine within a day or two. The problems went away. What did the glutamine cause in me? I don't know. I don't need to know. I don't care. I'm not going to spend a bunch of time trying to figure it out. All I need to know is that, Doc, it hurt when I did this. Well, then don't do that. I'm pretty sure that's what happened with me with tryptophan too. I think I tried it and I was like, I don't feel good on this. And then I didn't take it anymore. Now, that's not, everybody's different. So you may feel great on something that I don't, and I might feel great on something that you don't. I can tend to take high doses of things. When they agree with me, I can take high doses. I mean, I take 2 Lactoferrin capsules every day. I don't advise people to do that because most people, it's too much bile dumping. But also I'm six plus years deep in this process. So I'm not as toxic as a lot of you newer folks are. And you guys take 2 pills of Lactoferrin and you'll basically probably get a cold or a flu because you'll dump that much bile, the Lactoferrin cold. And then you come to me, I feel bad. Well, one of the first things, so kind of like you're saying, Austin, one of the first things, folks, if you get like a cold or a flu and you're taking Lactoferrin or niacin, especially if you recently increased your dose, you might need to take a break from those to calm things down because you caused too much bile dumping, and that's why you got the cold or the flu. And so you just take it out for a bit. Doc, I've been doing this exercise, and I do it like every workout, and all of a sudden my elbow started hurting. And I took a break from the working out, and then I didn't have the pain anymore. Well, you might need to not do that exercise for a bit. Does this make sense? It's the same kind of approach that we use in exercise, in health. Like, if you push something too hard, you might have to take a break from it. You could just reduce, but you might need to take a little break from it to let your body catch up on fixing whatever you did by taking too much of it. Okay? I would try to make sure if you're sick, if you're sick and you tend to get constipated, I would definitely try to do things to help yourself poop. Actually, again, don't email Julie about this, but Kelsey, actually, we're working on a effervescent magnesium citrate drink, sort of like versions out there that might be described with the word calm. So Kelsey made some up for us yesterday at the right ratio. I don't know if you guys know this, but a lot of the other the magnesium carbonate plus citric acid supplements that fizz in the water actually have a lot of extra citric acid in them, a lot, like a gram extra at the normal dose. And we tried making it without the extra citric acid in it yesterday, and it went, I felt really good on it. Kelsey took a little bit much, which if you know what happens when you take too much magnesium, well, you know, it comes out loose. But that's one of the reasons that magnesium citrate can be very helpful, is it can help with pooping. Kelsey wasn't complaining because she's a woman and women tend more towards slow bowels. And so Kelsey was kind of like, it didn't bother me. It was, it didn't bother her. She was kind of like, no, that wasn't a problem. And I didn't notice anything bowel movement wise, but But yeah, magnesium citrate, if you're going to take a magnesium citrate, don't use the pills or the powder where it's pre-made. You do one where it's magnesium carbonate and citric acid, non-GMO citric acid, where they react in the water, they fizz. And you can add hot water to speed up the fizzing, or you can just add room temperature water and it'll take a while to start fizzing, and then it will eventually all dissolve. But yeah, so we're working on fun stuff. Actually, potassium, we're working on a effervescent potassium citrate. So where it will be potassium bicarbonate and citric acid mixed together, and it'll fizz too. So that could be another, right now we've been using the micro ingredients pre-made potassium citrate. So it's a potassium citrate powder. But I asked Kelsey yesterday, this is one of the reasons I'm up here. I asked her yesterday to make me a potassium bicarbonate and citric acid effervescent mix. And I think we're going to try it today. So I'm excited to do that because I love potassium and I love citrate. In general, citric acid, I think it helps me feel better. I actually woke up this morning and I felt a bit less stiff than usual. So that was cool. Even though I've been working out hard on doing a new stretching routine up here, which if you guys don't know, like really vigorous stretching really can make you sore. I didn't quite understand when my daughter, who does dancing and lots of stretching, when she'd come home after dance and she'd like demand to take a magnesium bath. I was kind of like, what? You just did a lot of stretching. And now that I've been working on it, oh man, I totally get where she's coming from. So anyway, let's see. Let me see if there's any other questions I want to get to. Oh, sorry, another super chat. So thank you for the super chats, guys. Jenna super chat. I've had post-nasal drip with cracking voice for several months, like the vocal cords are paralyzed. Any thoughts to why this is? Thank you for the super chat, Jenna. Sorry, I'm glad I saw that one. Jenna, are you doing like the love your liver type stuff? Or are you working with any practitioner? I'm not recognizing the name if you are. Maybe you are. I'm not good with names, remembering. So just let me know. Hopefully you're still here. I'll start explaining while I wait for you to reply. So post-nasal drip, right? We got toxic stuff coming out, going down the throat. We've got cracking voice. So like the vocal cords are being affected. And she says, like the vocal cords are paralyzed. Okay. Remember how we I've been over this multiple times. Toxic bile can paralyze things like gastroparesis, like we just talked about in the stomach. Post-nasal drip would be, so just think about this. Just imagine this. Let's say, Jenna, that you have some amount of bile reflux coming up your throat. You may not notice it. Like, okay, folks, heartburn is not always something you notice. A lot of people have what they call GERD or acid reflux, which is really bile reflux. Always remember, it's always bile reflux. If you have heartburn or GERD, it is always bile reflux. Maybe you have acid in there too, but it's always bile. Sometimes it's just bile reflux. Sometimes it's bile plus acid. So Jenna, let's just say you have some bile going up your stomach into your throat, but it's not something you notice as heartburn. What it's doing is triggering post-nasal drip, and it's affecting your vocal cords. And so the way to help this, and if you had any history of GERD, then this would all fit in. The first thing I want to tell everyone is I want you to pay attention, because how many people who make supplements will tell you not to take a supplement if you have a certain condition. This is what I'm about to do. If you have GERD, or if you are recovering from GERD, any kind of bile reflux, I'm going to suggest that generally you either don't take lactoferrin yet, or you wait longer before you take lactoferrin. Lactoferrin will get your bile production going so strongly that if you have any history of GERD or reflux or heartburn, it will tend to aggravate it a lot. So like, Jenna, if you were doing lactoferrin, I would say that's one of my first suspicions. Is always, whenever there's somebody who has aggravated bile coming up their esophagus, I look at lactoferrin first. It's just that effective at increasing the bile production. Now, for some people, like for me, the 2 pills a day of lactoferrin makes me feel great. Like my mood is better, my productivity is better. Like I distinctly notice when I don't have my lactoferrin around. Some people notice with lactoferrin, it just helps. Some people notice that it can stir up stuff. And one of the biggest things that it can stir up, the most noticeable thing, is heartburn. So I would actually, Jenna, I would suggest that maybe you watch the GERD and bile reflux live stream. I think Joe might have already put it up. But yeah, I would go check that one out because I talk a lot about things that you could do in there. I think that's what's going on. The first thing that you could try would be the first 2 things you could try just to see if this is connected. One would be charcoal, because what you might do is, what I might do if I had this issue is I would have charcoal in water, whatever dose you decide to do. I would take a sip of it, I'd stir it up, sip it. So not pills. I would not do pills. If you want to help your stomach with charcoal, help your esophagus, help your throat, help your stomach with charcoal, you need to not do capsules, because the capsules, you want the charcoal to touch the bile and the aggravated areas. You want it to touch them. So if you take a capsule, the capsule is like a sneak attack, and it may not even dissolve by the time it gets through your stomach. So you might completely miss all the bile that's in your stomach, your esophagus, your throat, if you take capsules. So anybody who wants to take charcoal for throat, esophagus, stomach stuff, you need to take, you can just open up the powder in water and take it that way, or you can just get powder and mix it into water and take it that way. This is very, very important. So I might do some charcoal powder in water, stir it up real good, and then gargle some of it, or that swallow. I'd gargle some of it in my mouth and then I'd swallow it. Why are we gargling it? To expose it, to use the charcoal to soak up the bile that might be causing some of your postnasal drip and the vocal cord stuff. We would try to get, I'd try to, if you can really gargle it to get it deep down, as far down in your throat as you can, I think that would be great. And then you swallow it so it goes down and absorbs it. So like if you were going to do, I don't know, let's say 6 swallows of the charcoal water, I would gargle every swallow of it before you swallow it, so you can get the exposure to the throat, and then you can get the exposure to your esophagus and stomach. Yeah, Black Magic was asking, got to really gargle. Yeah, there's really gargling. Like, folks, when you really gargle, like you are trying to, in a certain way, relax your throat so you can get the gargle deeper, and it'll feel like you're right on the verge of potentially, coughing it up, choking on it. But you can get the gargle much deeper in your throat than you might realize. It should not just be like very superficial. Oh, Zendog says a spoon or 2 of black oatmeal every little while crushes the GERD. Yeah, so you could do the Black Oatster cult thing where, you could talk to Zendog Breath about that. Just eating charcoal in your oats if you chose to. But yeah, that is one way to crush the GERD. And then the other thing you can do is, as we talked about in that GERD episode, is you could, if you think it's acid reflux, like if you actually think, or if you try the charcoal, because all reflux has bile in it. Then you could try adding, or trying instead, you could try some like baking soda in water, anywhere from like start with just a 1/4 teaspoon, and you could do the gargle again, and then you could swallow it. Again, you want to do the powder, not pills. And then if it was the acidity of the stomach contents causing the symptoms, then with the baking soda, you should notice some improvement. So you're trying to figure out which one of these is it. It could be both. It could be just the charcoal. It could be the charcoal and the baking soda that relieve the symptoms. But yeah, that's my guess for you is that constellation of symptoms kind of in the back of the throat and up into the sinuses is quite possibly bile coming up. And if you've been doing the LYL for a long time, and if you were noticing as this problem came on, if you noticed any more like yellowing to your teeth, then that would be another indicator of bile getting up into your mouth. And what we had, just so anybody's not freaking out going, oh my gosh, this program could make your teeth yellow. If you have bile coming up into your mouth, your teeth could get a little yellow, yes. And what people have given feedback on is as they get less toxic, the yellowing of their teeth goes away again. So your teeth can unyellow. You don't need dentists to do whitening stuff and all this. You need to get the bile and the toxic yellow, bitter things that the bile contains not sitting in your mouth all day and marinating your teeth. And once you fix that, the teeth yellowing goes away. You know that beta carotene, plant vitamin A stains the teeth, and dentists know this. You know that coffee obviously stains your teeth. What are the dark things in coffee? Probably polyphenols. Polyphenols stain things. You ever spill elderberry on anything? Okay. Zendog was just adding something. He says he does baking soda and charcoal, but he does them separately. They both help. Charcoal helps much longer than baking soda. Psyllium in charcoal seems to help even more. So yeah, so again, these are good points by Zendog, like different fibers. You got to try different fibers. Some people are finding that apple pectin is really helping in situations where I normally would say charcoal, but people are finding that apple pectin is really helping them in certain situations. So what am I working on now? I'm working on a clean, just apple pectin powder. It's not out there very much. So I'm working on that to bring that out. Right now we got apple pectin capsules, which tend to have, they have additives in them. Oh, for those of you who don't know, we just came out with our own zinc picolinate pills and selenium glycinate pills. So if you're interested in those are now in the store. Remember, you LYL people, go into the VIP store where you get your LYL discount. But yeah, we're working on a bunch of new products, several fiber stuff. We're working on getting the sun fiber back and then getting a couple of new fiber products. I just mentioned the apple pectin. The different fibers, folks, you got to try the different fibers. Some people get along great with oats. Some people get along great with beans. Some people don't do well with either of those or one or the other. And so they do psyllium, or they do apple pectin, or they do sun fiber, or they might even do, well, I'm not going to mention the other one. We're working on that. So, well, okay. Black Magic asks, is zinc chelate no good, even from a reputable brand? We just went over this, I think, the other day. So they did a supplement of in the copper and zinc episode. I think that was that last week? Yeah, last or Thursday at least, or Friday, I mean. They gave zinc gluconate, I think it was. Basically, okay, zinc picolinate is the only zinc, it is a chelate, is the only zinc chelate that I find works consistently to bring people's zinc up. I have lots of people who tried other zincs and they say, I feel fine on them. I feel fine on them. I don't have any problems with them. And then I look at their zinc on hair testing and blood testing, and I go, your zinc sucks. I mean, to be blunt, your zinc sucks. It's not working. And they're like, oh, really? And then they take zinc picolinate, and then finally their zinc comes up. But also oftentimes we have people say that they finally feel something, whether it's positive or negative, from zinc picolinate. And why do I believe they finally felt something, whether it's good or bad? Because the zinc finally got into them. Picolinic acid is actually part of the niacin, the tryptophan pathway, like we talked about earlier with niacin. Picolinic acid, which is the picolinate, is actually part of that pathway. We are working on a zinc niacinate. We have zinc niacinate, which is another form of niacin bound to, it's zinc bound to niacin, flush niacin. That is in the Keystone Minerals Plus niacin. And then we're working on, we have formulated the zinc niacinate as a liquid, and we're working on the zinc picolinate as a liquid again. We got to get that out. So that's, those are the two that I like. But funny thing is, both the picolinate and the niacinate are both along that same tryptophan pathway. And those are the ones that, I mean, zinc niacinate works for sure. So we have that. But regular zinc chelates, if it's just a zinc amino acid chelate, I haven't seen those work. I haven't seen, I mean, yeah, after all the years I've been doing hair tests and using different types of zincs, even OptiZinc, the zinc L-monomethionine and zinc sulfate and zinc gluconate, none of them work as well as zinc picolinate. So yeah, we made a 15 milligram and a 30 milligram, and that's what's going on. So Christina asks, you're welcome. Do you know that the quality of lactoferrin is not the same with this batch? It seems to have more rice powder in it, like a lot. So consistency is quite different. Christina, we have okay, this is an important thing to know about the lactoferrin. Our manufacturer messed up bad, and they added rice, the brown rice flour to it, the filler, before, well, I had already told them no additives, and they added it by accident. And all of a sudden they tell me, oops, we already added it. Now, buying that lactoferrin is both hard to get. It's hard to get and it's expensive. So we weren't going to waste the whole batch because of this brown rice flour. Now, Christina, you should know that only happened with one batch. So it's all the same batch. And that will never happen again. So I don't know how it would be different because it's all the same batch. Yeah, it was total. So there should not be any difference in terms of the lactoferrin or the brown rice flour because it is all the same batch. That's all I can say about it. It's still the same stuff that I'm taking, and it seems to work fine for me. So I don't know. I can't say if anything's different in the bottle you got, but it's all the same batch. So that's what I got on that. Yeah, and just so you guys know about the zinc picolinate and the selenium glycinate, they both have organic brown rice flour in them and organic extra virgin olive oil, because the manufacturer that we used, I'm still learning about the supplement industry and all the things that they have to do. So those of you who ever get into supplements, if you work with a company that makes tons of pills, tons of capsules, they require a filler and they require a lubricant. So I believe this one manufacturer that I was talking to about making pills, he educated me on this, and he said that if they have these really high capacity machines, they have to do a filler and they have to do a lubricant. He was saying, well, what we use is they use that, what is it, the hydroxymethyl cellulose? I might have said the full HMPC or HPMC, hydroxypropyl methyl cellulose, or whatever it is. It's like, it's not something I want to use. And they used magnesium stearate. Many of you are familiar with magnesium stearate as a lubricant and a potential thing that we don't want to consume at all. So he told me, I was asking him, this guy is great. I love this guy. He was saying, we can't do that. We can't do what you want. And I was just like, great. Thank you for telling me. They do our bags. They do our powders. They don't add anything to the powders. But he told me, like, for us to make your capsules, this is what we add. This is what we do. And I said, okay. And I said, well, with the other manufacturer for these mineral capsules, I didn't realize that they were a high capacity manufacturer. And we were already so long in production with these. I think it took them 16 or 17 weeks to get it out when they told us it would be 4 to 6. And then they were like, well, we have to use a lubricant and we have to use a filler. And I said, okay, so we're doing this. So just so you know, because I insist on doing things as well as possible, the next time that these zinc picolinate and selenium glycinate pills are made, I'm going back to the same manufacturer. We were trying a new manufacturer. I'm going back to the same manufacturer who makes the flush niacin pills and our Keystone Minerals pills. And so there will be only a filler. There will be no lubricant in it because they are not a super high capacity manufacturer. They can do just a filler to make the capsules fit. And those of you who don't understand about capsules, you can't put 150 micrograms of dust of selenium glycinate into a capsule and not put a filler in it, because people would look at the capsules and they'd be like, the capsules are empty. Why are my capsules empty? And everybody would send them back thinking that, why did I not get what I paid for? So if you want capsules, you need a filler. If you try to measure out 150 micrograms of selenium for yourself at home, good luck with that. I hope you have a really good microgram scale, and I hope you don't overdose yourself, because dosing micrograms is very, very difficult. That's why we're doing the liquids. We're going to have 10 micrograms per drop of the molybdenum or selenium in the liquid products we make. So you can really dose it finely tuned. But if it wasn't in a liquid, who's going to measure out 10 micrograms of something? So yeah, that's what I got on that. But yeah, Christina, I don't know of any differences to that. It's all just, it's the same. It's the exact same stuff. So I don't know what you're noticing is different, but it's the same stuff. Okay. Let's see. Anything else that you saw, Joe, that would be really good to do? I think we got to wrap it up here pretty quick, though, so I can get to the inner circle. So again, if we miss any super chats, let us know. Let me go look. Okay, so Joe says that's it. Let me look through the questions and see if there's anything that sticks out. Okay. Let's see. I'm just going through the chat here right now from the top down. I did the when will Sunfiber be back? Let's see. Joe's got all the links up. Joe wanted to figure out what artificial liver treatments are. I would love to know what an artificial liver treatment is. Oh, Mina Bechet added off-label use. They did the same thing with Accutane. Shocking that they would make toxic things off-label uses so doctors can sell people on what's the off-label, what's the big off-label use for Accutane and semaglutide? Well, it would be vanity directed. Right? I remember in the early days of the semaglutide ads, they'd be like, oh, it's for diabetes. Oh, and you may lose some weight with it. And now they're selling it for just weight loss. Okay. So Doc Hooks Hunter or Sangoku asks how to reverse IBS-D caused by Accutane and also musculoskeletal problems. Help us, please. It's the same approach. You can, so for anybody out there, it's funny on like Twitter, some people will call me a grifter and I'm just trying to profit off of people. And then the people who know better will come and comment and say, if you just watch my live streams, you'll pretty much catch. You could, if you watched enough live streams, and this is what they say, they're like, if you watch enough live streams, you can pretty much get most, if not all of the stuff that's in the Love Your Liver program from the live streams for free. So it's always funny when people call me a grifter. Some people say I give more free information than more free, useful information than anybody on the internet, which is a really big compliment. So the one thing, so you might want to watch, there is an episode on SIBO and leaky gut, which are very connected to things like IBS-D. The biggest thing you want to do for IBS-D, which is diarrhea, irritable bowel syndrome, diarrhea oriented, is charcoal first. Anything with diarrhea, charcoal is the number one go-to. Then if you got into the Love Your Liver program, then there is the homeopathic detox therapy section, which is where if you know that Accutane messed you up, then you go for the homeopathic remedy for the Accutane in the homeopathic detox therapy. And inside the program, I tell you how to do it all. And it would still be less expensive if you ordered the remedies and bought the Love Your Liver program. It would still be less expensive than you probably going to a homeopath for the same recommendation. And then you'd also do the Polybowel Plus, the gut reset homeopathic as part of that. And yeah, complete instructions are in there. So those would be the big things for that. There's also the celiac episode that you could look at, which is obviously another digestive condition. And yeah, but yeah, charcoal for diarrhea is the first line. You can shut down diarrhea with if you take enough charcoal, you can shut down diarrhea. Absolutely. So that's what we got. Okay. Oh yeah, Christine Hoflick pointed out to see my live stream number 156, the low toxin nutrition and diet basics. That is the basics of the diet that we do. Absolutely. Number 156. So, Lodenko asks, a friend of mine just started, he wrote it trizepatide. It's actually TIR-zepatide. Sounds like it's the same as semaglutide. Yeah, does trizepatide strip the gut lining? No, well, if it's injectable, it doesn't have that snack in it, the SNAC. So the injectable stuff has one less damaging ingredient in it. But yeah, it's okay that you joined late. Yeah, tirzepatide. Everybody's saying it's safer. I can't remember. Let me look up and see if I had found something on. Let's see, hepatic. Everybody's trying to say it's safer. Yeah, absolutely. And there was some guy on Twitter trying to tell me that retroglutide or something was. I mean, they're coming out with so many of these. Yeah, I'm looking here on this one, and they're saying, oh, it helps the liver. It helps the liver. Remember, they said the same things about semaglutide. They're still trying to say it about semaglutide. It's going to be a disaster. Yeah, I don't see anything. This is why, remember, just like what they did with BPA, right? Bisphenol A, when they added it to all the plastics. This is what the industry does. This is what the pharma industry does. This is what the chemical industry does. So BPA, people started saying, oh, it's so toxic. Oh, it's so toxic. We want BPA free. And they start taking it out of things. People still want plastic. So they just replaced the BPA with something new that had less research on it saying it was bad. This is what they do every time. So semaglutide, ooh, the research is coming out. It's not looking good. Let's make a new GLP-1 agonist that doesn't have as much research on it. And then in the early days, because of the duration paradox, they can say that it helps things just like they did. I showed you at the start of this. And then the long-term stuff hasn't really started showing up yet, or there aren't enough case studies. And they're still saying, ooh, this is a rare thing. Ooh, this is rare. This is rare. While the class action, actually, let me go and search. Let me go see if there's any lawsuits on class action lawsuit tirzepatide. Oh yeah, it's Mounjaro. Let's look at this. Hold on. I'll share my screen in a sec. Okay, let me get this. Okay. Joe, what's up? So yeah, tirzepatide Mounjaro is in the lawsuits. They're consolidating them with the semaglutide lawsuits. In February 2024, so not that long ago, Mounjaro lawsuits were consolidated, put together with other similar drugs in a federal multi-district litigation. Yeah, the Bjorkland lawsuit claimed that tirzepatide and Ozempic, another type 2 diabetes drug, caused serious personal injury with symptoms ranging from severe vomiting to gastrointestinal burning. What would be burning your gastrointestinal system? Oh, I don't know. Toxic bile, maybe? So, yeah, see if you qualify for a weight loss and diabetes drug lawsuit. There's no specific Mounjaro class action lawsuits. They're just lumping it all together in with the semaglutide lawsuits. So, yeah, I'm going to say you're going to want to pass on that one. Let me go back and see what else was there. Here, I closed that window. Okay. Eli Lilly does tirzepatide. Wait, what? Let me see this. Hold on. Oh yeah, let me show you this. So okay. So this is Eli Lilly's webpage. Okay. For investors. Gosh, what are the investors worried about? Lilly filed a lawsuit to protect patients. Lilly cannot validate the safety or effectiveness of products claiming to contain tirzepatide that are not our own branded product. Because of this, Lilly filed lawsuits to protect patient safety and stop the unlawful marketing and sale of non-FDA approved compounded products, fraudulently claiming to be Mounjaro by medical spas, wellness centers, and compounding pharmacies. These entities should be stopped from providing drug products in violation of consumer protection laws, particularly where they promise their patients that their drugs offer the same safety profile and clinical benefits as Mounjaro. Well, I mean, counterfeit stuff would be important. That's going to be a bad thing. You know, I don't know if you guys know, but a lot of the men's erectile supplements that come from China will often have they'll have Viagra in them or Cialis in them. So they're actually putting tainted drugs into the herbal supplements. So you gotta watch out. You start getting in. I mean, it's pretty crazy that compounding pharmacies would be in here. A compounding pharmacy doing something that's not the actual med would be really bad for them. But still, what if they're just doing this lawsuit to say, well, don't buy it anywhere else because our profit goes down. And it's not the real stuff because we're seeing more, let's say they're seeing more side effects out in the general population from this compound. But Eli Lilly would like to control the research that comes out so they can tell everybody how safe it is, even though out in the real world, it may be proving to be much more damaging than they're saying. You see what I'm saying? They're protecting their turf and they're protecting their reputation. But is it potentially because it's not good stuff? Well, let me see. Products claiming to contain tirzepatide that are made and or distributed by compounding pharmacies, like a compounding pharmacy to not put the actual med in it, they're in deep, deep trouble of losing everything they have. Or distributed by counterfeit sources have not been reviewed by the US FDA or global regulatory agencies for safety, quality, or efficacy. Well, I mean, Big Pharma they hate compounding pharmacies because they don't get to have their patent. So they don't get to make as much money. For safety, quality, or efficacy are not FDA approved like Mounjaro. That's their defending their turf and may expose patients to potentially serious health risks. Well, does Mounjaro do that by itself? That's the question. Yeah. So I think that's what we got. Yeah, I got to get to the inner circle now. I'm late as usual. So this, again, you guys, Joe, if you want to start putting up the links. So we're wrapping it up here today. nutritiondetective.com is my main website where you can find the supplements I mentioned that we sell. We try to keep everything, as small a dosing and small an ingredient list as possible, and try to stick with no additives and other things that we don't have to put in there. We have new stuff coming out soon. There's the testing and consultation there at the website. There's also members.nutritiondetective.com, which is the Love Your Liver program. If you want to join that and be in kind of a social media network, if you will. It's a private network with other people doing this exact same journey that you're doing, and you can get my whole program in there and all the details. Like I said, I just added a big selenium section there. I'm going to be reworking the zinc section there, starting on that hopefully tomorrow. And then, yeah, this is the last Idaho episode. I will be back in Tucson next week. I'm not promising anything. I might do MS. People have been asking me to do an episode on multiple sclerosis. I haven't done it yet because my initial look into it, I didn't find a lot of obvious stuff like with the other topics I've done, but it's there. Joe just put up my Twitter. That is where I that is my social media place. I'm not really doing much. We do have Facebook and Instagram profiles, but if you want the most up-to-date and most hard-hitting stuff, you're going to find that from me on Twitter. Okay, well, I think that's everything. So hope you all enjoyed that. If you're going to mess around with these GLP-1 receptor agonists, I don't know what to tell you. Probably going to end badly if you take them long enough. I think it's already showing. The cracks are showing. So I would, you can send this to your friends and your family. Hopefully we can prevent them from damaging themselves. And I will see you next week. Have a great week. Bye now.